Yeah, we'll get started in about 5 minutes. Good morning. If you want to find your ID badge and then just have a seat anywhere where there's books. Okay. We'll get started in just a few minutes. Good morning.
Hi.
If you want to find your ID badge on the table and just have a seat anywhere where there's books. We'll get started in just a few minutes. Okay. Good morning, guys.
Good morning.
Okay, let's see here. Test, test, test. That looks good. Okay. I think we are good to go. Okay. Let's see here. I'll just put these here for now. Everybody get a badge? Okay. All right. My name is Patricia. Uh-oh. and I am not showing up on the screen. Hold on one second. Hold on, I gotta. There we go. Hey, look at that. Okay. Let me adjust the camera real quick. And there we go. All right. We are ready to go. Okay. So my name is Patricia Laramie. I'm an RN. I'm the one who came up with this whole program. I'm going to make this super easy for you. All you have to do is stay reasonably awake. Okay. Make it super easy. You will have to practice a little bit. I can't really do much about that. Someone can tell you how to drive, but until you actually drive, you don't know how to drive, right? Same thing. So you will have to have some practice as well. But as far as learning, we're going to make it super easy. Don't try to overcomplicate it. Okay. A couple things before we get started. This class does meet on Mondays and Wednesdays from 9 to 1 for 4 weeks. Notice it's not Monday through Wednesday. I will not be here tomorrow. There is no class on Tuesday, just Monday and Wednesday from 9 to 1 for 4 weeks. We do live stream this. So what you see on this screen is what everybody out there sees. And if for some reason you can't make it to class, you can tune in on the live stream as well. So this is available on my YouTube channel, on Facebook, on LinkedIn, on Instagram, and a couple other places. I don't know where we're out there. So it's really easy to access. It's also in the online course, which we'll be talking about in a little while. You can also see it in there as well. So if you can't come to class, you can attend virtually. Now, the really cool thing about virtual, and my assistant is off this morning, so I've got to do this part myself. But the really cool thing about virtual is that when you post a comment or ask a question, my assistant actually puts it up on the screen, and I can answer your question live as you ask it. In this case, we're going to congratulate Sacco because Sacco passed the CNA test because of this channel. I got my results 3 days ago, so congratulations to you. So good job. And that's one of the benefits of attending virtually. If you can't come to class, you're not going to miss anything. You're seeing everything live. You can ask questions just like you were in class. It's available to you. The other thing, because I am live streaming it, that means that there's a replay available. So after class, how many of you got the welcome email? Everybody get, okay. So after class today, hi, come on in.
Good morning.
Good morning. You can just have a seat anywhere where there's books. So here or here. What's your name?
Giselle.
Okay, here's your ID badge. You can just have a seat anywhere where there's books.
Thank you.
So, oh, thank you.
Thank you.
So I forgot where I was. I'm sorry. Anyway, the live stream will help you. The live stream will help you if you can't come to class. Of course, coming to class is always best. Oh, reviews. That's what it was. So the review is available to you. You're going to get a wrap-up email after class, every single class, that's going to go over what we covered in class, as well as links to videos and a link to the review for everything that you're seeing on the screen. So if for some reason you had to leave early, you could review what we went over in class. Or I'm going to go over a lot of information. I'm actually going to talk nonstop for 4 hours. So it's a lot of content to cover, guys. You're not going to get all of it. I'm going to do my best, but you're going to kind of trail off here and there. So having that available to you to review is helpful as well. So that's always available to everybody. You'll also get a review sheet at the end of class as well that will help kind of summarize what we've gone over in class. Like I said, I've made this super easy for you. This room is available on class days from 2 to 4 p.m. So it's actually 1:30 to 4, but that's okay. So what that means is the first week you don't have anything to practice. You don't have any skills under your belt yet, right? We're laying a foundation. But after that, you're going to start learning some skills and you're going to need some time to practice. So you can practice in this room from the time class ends up until 4 o'clock. After you graduate, then you can come back and practice in this room from 1:30 until 4, and that's on the back of your ID badge. So if you forget when the practice times are available, it's on the back of your ID badge. Okay. And you'll get wrap up emails after every class. And you're going to get access to the online course, which we'll get into in just a little bit. So oh goodness, this is the book we're going to use. Okay. So before I get too far, this is the email list. So when you gave us your email when you signed up, that's what we use to send out that welcome email. That's kind of like a test. The welcome email is just hopefully, we didn't put any typos in because sometimes I do. So what I'd like you to do, I'm going to pass this around. I want you to verify that your name is spelled correctly. I want you to verify your email address, that there's no typos in there. If everything is okay, just write okay out to the side. If you have to change anything, write it in this space. So if I misspelled your name or your email address, write the corrected one here. And that way we can make sure that you're getting those wrap-up emails and the invitation to the course and all of those things. So I'll go ahead and pass that around. And just make sure you write okay. That way I know you've seen it. All right. So we saw this book just a few minutes ago, this book right here. This is the one that's in front of you. And this is the one that we're going to use throughout the program. The other book, the yellow book, we are going to use that too, but that's more for homework reading. You're not going to need that in class. So we're going to get to the yellow book in a little while. I've got a lot of stuff to tell you first. But everything that we're going to talk about in class is always in the spiral book. That's my book. You'll see my name on the front. I actually wrote this book. It's being used by CNA programs all over the country. We are the #1 CNA study aid on YouTube. We have over 100,000 subscribers. We're actually now at like 140,000 subscribers, over 35 million views. We're in the CNA space, #1 in YouTube world. We also are live streamed into classrooms all over the country, as well as internationally. So this book is being used widely. I know we're in very small Spring Hill. You wouldn't think that we were having a global impact, right? But we do. Now, this book is yours. You can write in it. You can eBay it. You can color in it. You can do whatever you want to with it. But that's the book that you're going to want to bring back and forth to class every day. Okay. So to get started, we're going to turn to page 17 in that spiral book. Now I'm going to explain how this whole process works in a little bit. We'll go over the syllabus. I got to turn the air on. We'll go over the syllabus and we'll go over the homework and all the books. We're going to go over all of that later in today's program. But right now, I need to start you off by explaining to you what a CNA is, how we know what to do with each patient, what are our frameworks for our scope of practice. So we have to go over all of that. A couple of housekeeping things before we get started, because I'm about to show you a video. I don't know why I have to tell you this. It's a very small room, but in case of fire, flood, or other natural disaster, your exit is there. It's the same door you came in. Don't know why I have to point it out, but there it is. If that one doesn't work for some reason, you can go out the back door. Again, unlock it before you go out. Otherwise, you won't be able to get back in. There's only 2 ways in and out of this room. The door usually opens up about 10 minutes before class. I am not an early bird. I do not like mornings. I will not be here early. So if you are here early, just keep in mind I won't be. So about 10 minutes before class is when I show up. Okay. We are here till 1. This is adult education. If you have to leave before 1, feel free. You can tune in virtually, you can watch replays, whatever you need to do, but you don't have to get permission. I'm not that kind of a teacher. Okay. If you need to use the restroom, get up and go. You don't need permission. Don't raise your hand, that type of thing. We don't need to do that. But I do ask that you are respectful when I'm teaching. I've got a lot to say, and I tend to get derailed pretty easily. So, try to keep shenanigans to a minimum. That's all I ask. Sound good? Easy? All right. So we're going to watch a video that's going to explain. Now, this video is going to be available to you after class. You'll get a link for it. You're going to see that everything in our class is based on repetition. Okay. So you're going to get a link to it, but it's going to cover skill rules. So page 17 in your book looks like this. Page 18 is going to be the notes from the video that we're about to watch. So you don't even have to take notes in this class. I've done that for you. Now on page 19, you'll see a gray box with some questions, and that's to help you. It's a workbook. Okay, so it's to help you figure out, did I get what I needed to get from this lesson? Sound good? Any questions before I show you the video? All right. You are free to fall asleep for anything else, but not this video. This video is the one thing I need you to stay crystal clear awake for, because it's going to form the foundation that we're going to build on for every class that's to follow. Okay? So let me go ahead and start the video for you. Oh, we got somebody watching from Kenya. Nice. Okay. The Care Plan and the CNA. Why it's always about the Care Plan. A presentation brought to you by foryourcna.com. Thank you for joining For Your CNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions.
This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation. Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
All right. Any questions on that? Any questions? How do we know what to do with each patient? The care plan. That's an easy answer. I'm going to be asking that question a lot in this class. And the easy answer is always follow the care plan. So CNA is not hard. We get a list of instructions. We do whatever the list tells us to do. And we report everything that we notice while we're doing it. That's what a CNA is. Not too hard, right? We have to learn how to do the skills, and the principals on the back wall are going to explain to us how these skills need to be done. And we're going to go over those. You'll know them all by next week, but it's not like memorization. We're going to learn along the way why each step is important and how it should be done. Okay. All right. So all of the notes for that video are located on page 18 and 19. And the video talked to you about activities of daily living. And I have a whole article on that on page 89 that you can read on your own. But ADLs, or activities of daily living, are things you do for yourself every day. So you probably got up this morning, rolled out of bed, probably went to the bathroom because that's where most people go when they get up out of bed. You probably got something to eat or drink. You maybe groomed or showered or bathed. You certainly got dressed because you're not in your pajamas. And then you got yourself here, right? Those are all things that you do for yourself every day. And you did them all by yourself today. I'm so proud of you. But what if tomorrow you woke up and neither one of your arms worked? They just quit working. Well, you're not going to be able to get yourself out of bed very easily. You're definitely not going to be able to go to the bathroom by yourself very easily. You're not going to be able to feed yourself or bathe or dress or groom. So you would need some help, wouldn't you? Well, the first person we usually call is mom. Hey, mom, come help. And if mom is around, they may come help. But what if there was no mom? Now you're probably relying on your significant other. Hey, honey, need help. But what if there was no significant other or they were unable to help? Well, then you're probably going to reach a little further out, maybe to some friends. And they've got to be really close friends for this, though, right? And if there were no friends, then you're now looking at relying on the kindness of strangers, people you would pay to help you with those tasks. Because at the end of the day, it doesn't matter who's helping you. You have to go to the bathroom. You have to eat. You have to do your ADLs, regardless of whatever else is going on in your life, right? That's where CNAs come in. We help patients with things they would normally do for themselves if they were able to, daily tasks. We're also going to help nurses with nursing tasks as well along the way. But most of what we do is help people with their activities of daily living. Good? Make sense? Make sense? Okay. So to recap, this is a very, very important process for us to understand. So when a patient comes into our facility as the nurse, I look at that patient and I try to find all their real problems and all their potential problems. Now, number one on my list is always toileting. I got to know how this guy's planning on toileting because everybody's going to have to go, like at least once a shift. Everybody. So we got to know how they're going to go. We know that's a real problem. So maybe they get up and go to the bathroom by themselves. I like that guy. Maybe he needs a little help getting to the bathroom. Well, we can do that. Maybe we need to bring a bedside commode to the toilet so he doesn't have to go so far. That's a possibility. Maybe he has a catheter. Maybe he's incontinent. Maybe he needs a bedpan, but I got to figure this out because I know he's going to be ringing the call light at some point saying, I got to go. And you guys need to know how to help him do that. Next on my list is eating, always, because people get hungry, right? So I need to know, what kind of a diet is he on? Do we need to puree his food? Does he have dentures that he needs in to eat with? Does he have any food allergies? You know, what kind of eating things do I need to know? Are we thickening his liquids? Is he on a fluid restriction? So that's the next thing I'm going to look at. Then I look at the rest of the ADLs, you know, bathing, dressing, grooming, mobility, you know, that kind of stuff. Or bathing, dressing, grooming. Mobility has its own special category because we need to know, is this guy staying in bed or is he getting out of bed? Like, am I going to get him out of bed and put him into a chair or a wheelchair? Or does he walk? Or is he just allowed to go wherever he wants to go and, you know, he's mobile on his own? We need to know mobility. And then we look at special things like vital signs, wound care, all those other types of things. But as the nurse, I've got to look head to toe on this guy, find all real problems and all potential problems. Now, what I just told you, TEAMS, toileting, eating, ADLs, mobility, and special, what I just told you are things related to CNA. Okay. Those are things you need to know. But as a nurse, I have to go beyond that. I got to tell you guys what to do, but I also have to go beyond that and think about things like what tests need to be scheduled. What are the prep for those tests? What were his lab values today? What were the test results? Do I need to get a hold of the doctor right away? I've got to start planning out things beyond ADLs. Does that make sense? Okay. So as the nurse, I've got a whole lot of responsibility here. So as I do my assessment, I'm going to develop the care plan. I'm going to tell you this guy has bathroom privileges, which means he goes by himself with assist. You need to help him out. He eats a regular diet, feeds himself. Yay. We like him, right? And we should encourage fluids because he's a little dehydrated. ADLs, he does everything on his own. He does all of his own bathing, dressing, grooming. We like this guy. And mobility, he's ad lib. He can get up and go anywhere he wants to go, any way he wants to do it. And special, we're doing vital signs every 4 hours on him because the reason that he's here is his blood pressure is high. Okay. So that kind of tells you what to do with that patient. That's part of the care plan. So I assess the patient, I develop the care plan, and that told you what to do. So when he rings the call light and says, I got to go to the bathroom, what does his care plan say? Anybody remember? Yeah, a system. Yeah. So that tells you that, yeah, he can go to the bathroom. We need to give him a little bit of help. So you already know when he hits call light how to help him. But while you're walking him to the bathroom, you notice that he gets really dizzy and a little wobbly. Who would you tell? The nurse. So as the nurse, he's dizzy, wobbly, he's here for blood pressure, he's on a new medication. He's probably not that safe to get up and walk by himself to the bathroom or anywhere else because remember his mobility is he can go anywhere he wants to go. So I'm going to change the care plan and we're going to make him a fall risk because he's dizzy on new medication. So the fall risk means that I now don't want him out of bed on his own. Okay. That means we're going to help him anytime he's out of bed. So that changed the care plan. That gave us a few new tasks to do. You guys see how this whole process works? Good. It's very, very important that you understand nowhere in there is a CNA thinking. Nowhere in there is a CNA thinking. You see CNA thinking anywhere? CNAs don't make decisions. So if you catch yourself saying, I think, you need to stop. You don't have enough information for that. Okay? Make sense? So if you catch yourself saying, I think, who should you tell? The nurse. Absolutely. So this really can't be all that hard, can it? We're not allowed to think. We just read the directions and follow those. If we can't follow those directions, we let the nurse know. They change the directions, and then we follow those new directions. Good? So the written test, guys, pretty easy. We're not allowed to think. Good? Don't be afraid of the written. Written's super easy.
That's my written. It was super easy.
Yeah, it's really easy. As long as you understand your scope of practice, the written is very easy. So let's see if we can put all of this together. Let's go to page 20 in your book. All right, page 20 is a care plan activity. There's 8 questions. 2 of the questions are going to deal with the care plan off to the side. I want you to read the care plan and answer the questions. You have 10 minutes. Does anybody need a pen? 1, 2. Okay. If they don't work, let me know. Do you need a pen? Got one? Okay. Go ahead and answer those questions. Okay, when you're done, you can put your pens or pencils down so I know who's still working. Okay, while we're waiting, if you keep your finger there, but go to page 197. You will see the answers for all of the activities, the workbook questions, everything is listed there for you. So you can always check your answers. Okay. Just want you to be aware of that for the future. So we can go back and finish this. Uh-oh, what happened? We can go back and finish this later. Hold on one second here. There we go. Okay. That should work now. There we go. All right. So just to remind you, we perform the skill as directed on the care plan. We follow the care plan, the whole care plan, and nothing but the care plan. That means we can't add to it. We can't take away from it. We can't change it. The care plan stands alone. When we're doing the tasks on the care plan, we're going to observe for any abnormalities, any changes, any complaints of pain, anything that isn't going well. And then who do we report those observations to? The nurse. So that is what CNAs do. Okay. We call those the skill rules. The skill rules mean that we follow the care plan, the whole care plan, and nothing but the care plan. We report all observations to the nurse, and we pay attention to the patient, how they look, how they sound, how they feel. We're looking for any wincing, grimacing, any signs of pain, anything we notice, any changes. Make sense? Okay. So I told you that we are going to learn all the things on the back wall. Well, we just learned the first one, skill rules. Skill rules tell us what to do. The rest of these are going to tell us how to do it. Okay, good. Now you're going to see this over and over and over as we go through this program. This isn't the last time you're going to see this. Trust me, you're going to get sick of this by the end of the class. But if we know that as a CNA, we have to follow the care plan, the whole care plan, and nothing but the care plan, wouldn't it be nice to have the care plan from the state exam? If I could give you the care plan if you know that, the test is going to test you on following the care plan, wouldn't it be nice if you had those care plans that they're going to be testing you on? Go to page 25 in your book. These are the 11 testing care plans. So when you're looking at this on page 25, you're going to notice there are 11 care plan sets. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. You'll notice that each one has 3 skills listed on it. They're not random, guys. They are not random. Each one of these clipboards, and this is on page 24, the bottom page 24, it explains this. But each one of these clipboards is going to have one ADL skill. Remember we talked about ADLs, right? Activities of daily living, bathing, dressing, grooming, toileting, that type of thing. So you'll get one ADL skill. You're going to get one documentation skill. So everybody's going to have to document something during the test. So pulse, respirations, feeding, and drainage bag are our 4 documentation skills. And then there's one mobility skill. So moving a patient. Okay. So each one of these care plan sets has an ADL, a documentation, and a mobility skill. And it may not necessarily be in that order. These are the classroom copies of this. So we have these. They're always up here. You can use these while you're in class. Each one of these has an ADL skill, a documentation skill, and a mobility skill. This is the order they'll be in on the state exam, whatever you see here. The state test is also on yellow paper. Mine's just a little prettier. That's all. Okay. At the bottom, we have timing information, which we'll go over a little later on in the program. And on the back side, come on. Okay. Well. Okay. On the back side are the actual steps that you're going to be graded on. These are the actual testing checklists that you're going to be graded on. So when you take the test, you're going to get your 3 skills. They're going to read it to you. We're going to go over all this in just a few minutes. They're going to read them to you, and then they're going to hand this to you, and that's yours throughout the entire test. They are going to use checklists. These are the exact checklists to check off your steps. Now, I am what sits right in between those two, okay? I am going to explain to you all of the steps that are required and why, if you miss a certain step, it can be detrimental on the state exam. So we got a long way to go. But this is up here for you guys to take a look at. But remember that you also have it in your book on page 25. Okay. So those are the actual testing checklists. All right. Any questions on that? Any questions? Let's go back to page 20 real quick and go through a few of these just to make sure that we got this. So number 1, you receive the displayed care plan. How far will you walk this patient? What do you guys think?
10 steps.
10 steps. Why? There it is. Easy answer. Care plan said. Absolutely. Number 2, you receive the displayed care plan. What is required to assist this patient to stand? Why can't I just use a walker? Okay. So what happens if I decide on my own to use a walker? Yeah, I'm going to get in trouble, right? I'm not going to get applauded for thinking quick. I'm actually going to get in trouble because I didn't follow the care plan. Now, if I stand a patient up with a gait belt and they're really wobbly and I think to myself, uh-oh, I probably should have a walker, what should I do with that information? Tell the nurse. You starting to kind of put those pieces together? Good. All right, let's go on to number 5. Number 5 says you receive the displayed care plan. What is a safety concern for this patient?
They're in an inappropriate position for eating.
How do we know that?
The care plan.
The care plan told us. Now, I'm going to tell you that care plans out there aren't going to tell you that. They're doing this for the test because they want to make it very, very clear that this patient is not sitting up straight. No matter what your eyes might be telling you, the care plan says that they're not in an appropriate eating position. So what do you think you need to do before you feed this person?
Sit 'em up properly.
Yeah. And for the test, it's just as simple as, can you please sit up? You don't have to manhandle them. Okay. So good? Makes sense? All right, let's go on to number 8. So number 8 asks, how long do you need to count for? What do you guys think?
1 minute.
Why? Okay. Now this one's a bit tricky. This skill is failed on the state exam quite frequently. This is pulse. Measure and record a radial pulse. It's not a hard skill. You're going to find a pulse. You're going to count the thumps you feel. But the problem is that if you go on to any video place out there, pick a platform, and you type in how to take a pulse, most of those videos are going to tell you to count for 15 seconds and multiply that by 4 to get your full minute reading. Or count for 30 seconds and multiply that by 2 to get your full minute reading. Or even better, grab one of these guys. It's a pulse ox. Anybody ever see one of these? We call them the clothespin. They fit right over the finger. You hit on, and it will eventually tell you what my pulse rate is, right? So there's videos out there that show you how to use this. Man, this is very, very convenient, right? So my pulse is 77. What does this care plan tell us to do?
To measure it at the wrist.
Okay, so to measure, so can I use that pulse ox thing?
No.
No. How long do I have to count for?
1 minute.
So if I did 15 seconds and multiply by 4, I'm going to fail. Not because I got the wrong number,
Because you didn't do it for a full minute.
because I didn't follow the care plan. Very good. Are you starting to see the importance of the care plan on the test? Our job is to read that care plan and do whatever it says. Exactly. If we do that, we will pass. Good? Does that make sense? Okay. So let's go into our scope of practice. This is on page 22. So we know that we have to follow the care plan exactly, and that is our scope of practice. Now, the care plan can be verbal. I can tell you, as the nurse, I can tell you, I need you to go change those sheets for me. Patient's going to stay in bed. It can be verbal. It can also be written. You are there to be the assistant to the nurse. Whether it's verbal or written doesn't matter. You're there to do what they ask you to do. Now, the reason for that is that the nurse is assuming all of the liability for that patient. So it doesn't matter that I'm asking you to go feed that patient. I am still liable for that action. Does that make sense? Everybody good with that? So what does that mean? Well, it means that if something goes horribly wrong here, I'm the one on the hot seat, not you. So if I ask you to help the patient to the bathroom and use a gait belt and the patient falls, well, that's on me, not you. As long as you did the task exactly the way you were told to do it, and you did it according to our principles that we're going to learn, I am the one that's liable, not you. Does that make sense? That is your scope of practice. Means that the nurse is liable as long as you are operating under the care plan. Now, because I'm liable for the patient, I don't want you guys out there making your own decisions, because I'm not going to accept liability for that. I will only accept liability for the things that I have delegated to you. Does that make sense? So, as a CNA, if you are outside of the care plan, you are now liable. If you're inside of the care plan, the nurse is liable. So, where do you want to be? Inside the care plan. Correct. Good? Does that make sense? The problem is that CNAs make decisions all the time without even realizing that you've done it. Because you want to help. CNAs have a great heart and they want to help. So let's look at the first bullet point there on page 22. It says the care plan. Patient must remain upright from 7 a.m. to 9 a.m. every morning. The patient is sitting in a chair at the bedside and asks the CNA to assist her back to bed at 8:15 because she has back pain. The CNA helps the patient return to bed as requested. What's wrong with that?
The patient must sit upright until 9 a.m.
Okay, it's 8:15. They say they have a backache and you help them back into bed. You thought you were helping, didn't you? What we actually did was hurt this patient because the patient has a medication that can cause esophageal ulcers if they lay down for 2 hours after they take the medication. It's very corrosive. So we actually just hurt this patient by putting him back in bed. What should we have done? Yeah, absolutely. Told the nurse about the back pain. Good. Makes sense? We mess this up all the time without even realizing it because we try to help. Remember, it's the care plan, the whole care plan, and nothing but the care plan. If it's outside of the care plan, who needs to know? The nurse. So that would be a possible written test question. Bear with me, guys. I have to go back and forth. My AC only has 2 settings, cold and hot. That's it. There's nothing in between. So you'll see me run back and forth to turn it on and off during the class. All right. So a good part of what we are going to be tested on, not just on the skills, but also on the written tests, is following the care plan. Okay. So let's look at the top of the second column here. The care plan tells us to provide a partial bed bath to a confused patient. The CNA notices the patient scratching many places on the body. There are no visible sores, lesions, or bug bites. So the CNA determines the patient's skin is dry and applies lotion. Is that appropriate?
No, because they're not following the care plan.
Okay, because the care plan didn't tell us anything about lotion. So would we get in trouble? What should we do with that information?
Report it to the nurse.
Report it to the nurse. Absolutely. This is actually a potential sign of liver dysfunction. Could also be an allergy to the detergent that's used on the sheets. It could also be about a million other things because widespread itching is a sign in multiple different disease processes. So just by putting lotion on and not telling anybody that the patient is itchy, we've missed a valuable clue that might let us know that something was wrong with the patient. Does that make sense? So even something that small, that insignificant, just putting lotion on a patient can actually cause you to get into trouble. Does that make sense? You'll see questions like this on the state exam because they're trying to make sure that you truly understand your scope of practice, because that's really what gets CNAs into trouble out there in the clinical world. Good? Make sense? All right. Okay, so to keep us firmly in our scope of practice, this is on page 13. We have the 5 key phrases. Now, this is so important that it's over here on the wall all by itself and you're going to stare at it for the next 4 weeks. It's also on the back of your ID badge. That's how important it is. This, what we call the Happy CNA Place, is your scope of practice. Now, everything starts with the care plan, the whole care plan in. Nothing but the care plan. That's our foundation. CNAs do normal. That's going to keep us in our safe place. CNAs do normal. I don't have a big one up here. CNAs do normal. What does that mean? CNAs do routine tasks on stable patients. So let me say that again. Routine tasks on stable patients. So that means if we have a task that's not routine, it's not a CNA task. So we know that taking a radial pulse is a routine CNA task, right? We find the pulse, we count for however long our care plan tells us to, and we write that number down. That's a radial pulse. But what if the patient has no arms? Is that now a routine task? Right? CNAs take radial pulse in the arm. If there are no arms, is that a routine task? No. So that task would not be suitable for a CNA. A nurse would have to find a pulse in a different area. Does that make sense? Good. Routine tasks. It also needs to be a stable patient. Well, what does that mean? Well, if your patient is in the ICU crashing at the moment, that is not a stable patient. That is not a CNA type of patient. Does that make sense? If the patient is expected to change rapidly while the task is being performed, that is not a stable patient. CNAs do routine tasks on stable patients. Another way to think of that is CNAs do normal. We're there to help. Principles, everything on the back wall, are going to tell us how to do these steps and keep us safely in our scope of practice. If we aren't doing the steps the way these principles tell us to, we are not in our scope of practice. So we still have to learn all that, but it's going to keep us firmly where we need to be, keep us from venturing outside and getting into trouble. Now, above all, above everything, it's always about the patient. Now, that's my biggest job in this classroom. It's actually the thing that I find the hardest to teach you, is that it's always about the patient. Because right now, you're thinking about the test. You're saying things like, I want to pass the test. I need to practice to pass the test, right? The focus is on you. In these 4 weeks, I've got to get that focus off of you and onto the patient. Because if you can make that change in your brain and you can start focusing on the patient rather than your steps, you will ace the exam. Because that's what the exam is focused on, is the patient. So above all, it's always about the patient. So you're going to hear me give you a lot of tips all the way through the program. But one of the questions you're going to have, I know you will, is, do I just say everything you say when I'm doing these skills?
Yes.
And the answer is yes, but not for the reason that you think. Because you're still thinking about, I want to pass the test, right? You're thinking about the checklist. You want to get all of those check marks. That's actually not why you have to say the steps out loud. You have to say the steps out loud because the patient has no idea what you're doing with their body. See how that's a little bit of a change in the way that we think? So I'm going to help you with that through these next 4 weeks. By the time I'm done with you, hopefully, you're going to be thinking about things from the patient's point of view, not from yours. That's the hardest job I have. I've been doing this for 17 years in CNA education. Yeah, long time. So I know what you're going to ask before you ask it. That means that I probably have a slide coming up that's going to address whatever it is that you have on your mind. All right. So the other thing that keeps us safely in our space is that we report everything to the RN. So we follow the care plan. We do normal. If our patient isn't stable, we tell the nurse no. If it's not a routine task, we tell the nurse no. We're going to use the principles. So we're going to do our skills like we're taught. We're going to remember that it's always about the patient, and we're going to report everything to the RN. Those 5 things are going to keep you safely in your scope of practice, and it'll keep you out of trouble. It'll also get you a perfect score on the state exam. Okay? Good. So let's talk about delegation now, because sometimes the nurse is going to ask you to do a skill that you may not be familiar with, something that maybe you haven't done before. And it's a routine task, it's a stable patient, but it's not something that you have any experience with. Well, in that case, the nurse can train you to do that task. Now, there's a couple of rules here that the nurse has to consider. Okay. First, they have to figure out, is it a routine task? Then they have to figure out, is it a stable patient? Then they have to figure out, does my facility let me delegate this to somebody else? And does the state law let me delegate this to somebody else? So they got a whole bunch of questions that they have to answer. But once they decide, okay, this is a delegatable task, you may not, what's your name? Giselle? Okay, so you may not be familiar with how to do that skill, but as long as it's delegatable, I can teach you how to do that skill. Okay, make sense? Yes. Now, teaching doesn't have to be in a classroom. Teaching, I may take you to the bedside and say, okay, this guy has no arms. You normally take radial pulses. This is what I want you to do on this person. And I'm going to show you how, and then I'm going to watch you do it. So training may be at the bedside. It may be in a classroom. It may be some videos that they ask you to watch, and then, they watch you do it afterwards to make sure that you got it. Training can happen in a lot of different ways. Don't be afraid to learn new skills beyond what we're going to learn in this classroom. Here, we're going to cover the basics. We're going to lay a foundation. But every skill that you're going to learn from here on out throughout your career is still going to be bound by all of these rules on the back wall. So you already have a foundation on which to build new skills on. Good? Make sense? Okay, so nurses are responsible for knowing whether something can be delegated. They're also responsible for making sure that you're trained to do that task. If you are not trained, you need to say, no, I'm not trained. If it's not a stable patient, you need to say, no, that patient is not stable. Make sense? But you can pick up some new skills as you go through your career. Let me give you an example. So in here, we are going to learn how to clean a catheter and the skin around the catheter. It's called catheter care. And that's all CNAs usually do, is just clean the catheter once a shift and the skin around it. Just keep everything nice and clean. Reduce infection risk. CNAs in this class are not trained to put catheters in, and you're not trained to take catheters out. It's not a standard CNA task. But let's say that you go to work in a rehab center. Or let's do it a little bit different. Let's say you go to work in a same-day surgery center. So this is a place that you go in the morning, you have your surgery, you recover, and then you go home at the end of the day, right? You don't stay overnight, you go home. Same-day surgery. Well, when you're having surgery, a lot of times they put catheters in because they don't want you peeing on their sterile field when they put your body to sleep, right? So they put a catheter in once you're out. They put a catheter in. And then before you go home, that catheter has to come out. So let's say that you're working in a same day surgery center and you're working in post op after surgery. Now, I know that this is a routine task. These are stable patients are getting ready to go home, right? Routine task, taking a catheter out, it's always done the same way, no judgment required. I can train you to remove catheters. It's super easy. You take water out of a balloon, it slides out like spaghetti. Super easy. So I can train you to do that. Now, our facility doesn't let non-licensed persons insert catheters. So even though you're working in post-op and I can train you to take catheters out, you're working in pre-op, I can't train you to put a catheter in because our facility policy is only licensed people do that. Does that make sense?
Yes.
Now, if my facility didn't have that policy, then I might be able to train you to put catheters in. Good? Makes sense? So we have to look at your knowledge base. We have to look at facility policies. We have to look at how stable our patients are and our state laws to figure out what is delegatable. And this page tells you all about delegation. So throughout your career, you're going to come across this situation a lot. Nurse is going to say, I need you to do something. And you're going to go, am I allowed to do that? And always remember that number one, you have to be trained. If you are not trained, you cannot do this, no matter what it is. And watching a YouTube video on your own is not training, by the way. Okay. It's like, have you ever seen those commercials where somebody does something like super crazy because they stayed in a Holiday Inn last night? Right? That's not what this is. We can't watch a video and decide that we can perform a trach. Okay. So the first question you have to ask is, have I been trained to do that? All right. So as long as you are doing what the nurse is instructing you to do, either verbally or through the care plan, you're doing it on a stable patient, you're adhering to our principles that we have to learn, the how to perform the skills, then you are not liable for anything that you do. The nurse is. The minute you step outside of that, though, you assume liability. So let's talk about that for just a second. There is a, how do I put this? Anybody ever hear of or see an ad, CNA private duty will come to your home, take care of your grandma or whatever. A lot of people that are CNAs will try to work on their own. You get paid more, right? When you go through an agency, they're going to take their cut, obviously, right? So you get paid more if you go private, and that may seem really appealing. But the problem is that CNAs are responsible for following the care plan. If you're working private, there's no RN to develop a care plan. So now you are operating on your own, which means you are assuming 100% of your liability. You need to remember that, because if something goes wrong, that family can sue you personally. So if you decide to go out on your own, be aware that you are now assuming the liability for every action you take. Does that make sense? It's a very appealing opportunity for CNAs because you do get paid more and you're your own boss. I mean, how great is that? But you have to remember that with that comes the trade-off of liability. And I have seen this bite CNAs in the butt because it starts off great. It always starts off great. Always starts off great. You meet the family, you get along, it's wonderful. You know, you take Miss Mildred to church and you do her grocery shopping and you make her little meals and you do her laundry and life is great until you have a flat tire and now you can't go in and take care of Miss Mildred. And there's no agency to call to send a substitute. So Miss Mildred is there by herself today and she gets up and goes to the bathroom and falls and nobody finds her for 10 hours. Who do you think they're going to blame? That's right. So you got to be careful with that. Okay, just remember liability. Okay, so let's move on. Awesome, Caitlin, you're back. Let's move on to page 12 and talk about the CNA exam. So I've got a whole video on this. When you look at a page in my book and you see this little video clapboard thing, that tells you that I have a video for this. Now, I'm not going to show the video in class. You can go watch it on my website, watch it on YouTube, watch it in the course. I'm all over the place. I'm going to talk to you about it, but remember that there is a video available to you. So on testing day, all of you guys are in the third week of the program. I'm going to give you the registration packets. We're going to fill them out in class. You're going to submit them whenever you are ready. Some of you have to wait for paycheck. Some of you have to wait until after your vacation is done. I had one in the last class that had to wait until her baby was born, right? So everybody's got something different going on. So you will register when you are ready to do so. That means that all of you are registering independently. On test day, when you go to our testing center, and our closest testing center is down in Tampa. That's our closest testing center. I know you guys are getting cold. So our closest testing center is in Tampa. When you go to Tampa, to our testing center, you are going to be there with 7 strangers. They test 8 people a day, 7 days a week. So you might be testing on a Sunday. You might be testing on Easter, right? They only close on major holidays. New Year's Day, Christmas, Thanksgiving, 4th of July, Memorial Day, Labor Day. That's it. So you're there with 7 strangers on testing day. When you go in, the only things that you can take with you is 2 forms of ID. One of them has to have a picture, like your driver's license. The other one has to have a signature, like your Social Security card or a bank card or something that has a signature. So one with a photo, one with a signature. The names have to match. You can take your keys in with you, and you can take your test admission letter. You cannot take electronic devices or study material. So your cell phone needs to stay in your car. If somebody is dropping you off for testing, you can take your cell phone in, but they're going to lock it up in a locker. Good. Can't take study material into the center either. So you go in and you're there with 7 strangers and you go into a waiting room. Now, off of the waiting room, there's going to be 2 rooms. One of them is a computer room where you're going to take the written test. The other is a clinical skills room where you're going to demonstrate 3 skills in front of 2 RN evaluators. But it's important to know that they are both closed rooms. So when you're in the clinical skills testing room, nobody else can see your performance other than the ones that are in that room. Everybody else is locked out in the waiting room. So you're not on a stage performing in front of hundreds. Nobody else is judging your performance. It's you, a partner, and 2 evaluators. So when you go in and you are there with 7 strangers, the evaluators are going to check you in, make sure you are you and you're not trying to test for somebody else. And they're going to ask you, you're going to have to sign an affidavit, and they're going to ask you if you have any limitations that would prevent you from being a patient for any of the skills. Because after that, they're going to leave the room for about 20 to 30 minutes. And while they're out, they're going to be pairing you up with another testing student. This is not random at all. Not random. So it takes them a few minutes to put you into a specific group. Now, the reason for that is that, so in here, I'm going to divide you up into groups of 2. I'm going to make it random, but I want to show you why in just a second. So you 2 are group 1, you 2 are group 2, you 2 are group 3, you 2 are group 4. Okay, so I'm just going to randomly divide you up. Now, the reason for that is because you have mouth care. Okay, so that's one of the skills you have to perform is you're going to have to brush somebody's teeth. Well, she just had some dental work done, so she can't be a patient for you. She's fine. She can be a patient for you. Okay. Let's say that one of your skills is to transfer from bed to wheelchair. Well, we want to try to find somebody your body size or smaller. So we don't want to pair you up with somebody that's significantly bigger than you. So that's going to play into this. We're going to see, you have foot care to perform and you have athlete's foot. You know, we don't want to pair you together. So when they are pairing you up for your skills, they have to look at your limitations as well as what skills you have to pair you up with somebody so that they're setting you up for success, not failure. Good? Make sense? Questions so far? Okay, once they pair you up, they're going to take the first group into the testing center, the clinical skills room. So you guys were group 1. You would be brought into the testing room. Now, the testing room would look like this. If I put a wall straight across here and a door in it, this would be our testing center. It's going to have 2 beds, a supply shelf, a hamper, a sink, and a toilet facility. Okay, so all of this would be our testing room. But you've never been there. You don't know where the supplies are. You don't know how anything works. So they're going to take you in and show you around. They're going to show you this is our privacy curtain and this is how it works. So this particular one, I know you guys can't see me on camera. I'll move it in a minute. If you notice, these curtains only go out about 4 feet. They don't go all the way around the bed like they would in a clinical setting. Now, the reason for that is you're being tested. They need to see what's happening inside of that. So the curtains are not going to extend all the way around the bed. They're only going to extend it a short distance so that what you're doing is still visible for testing. Does that make sense? So they're going to show you, this is a closed curtain. This is an open curtain. Good? Questions? Once they've showed both of you around and you know how the bed works, the curtain works, you know where the sink is and all of that, then they're going to give one of you a skill list. Now, this is not random. Not random at all, actually. Your skill list is actually coded into your ID number. So that means that when you register for the test, your skills are already selected back when you register. That keeps the evaluators from doing things that aren't ethical. You know, like if you park in my parking spot this morning, I might be mad at you and I might give you the hardest skills because I'm mad at you. Okay. So that keeps everything very random. Does that make sense? Okay. So can you give me a number 1 to 11? 5. Okay. So the computer randomly picked skill set 5. It just does not want to The computer randomly picks skill set 5, and you're going to go first. So your skills are measure and record respirations, make an occupied bed, and change position to supported side lying. Now, you need a patient to do those skills on, so you would be the patient. The evaluators are going to set the scene. So the evaluator would tell you, okay, the first skill is respirations. I need you to lay down in the middle of the bed on top of the sheet is fine. Okay, so they will set the scene. They also give you a script. When you are the patient, you are to be pleasant, cooperative, and you. So one of the skills we have is ambulate with a gait belt. That's just a fancy word for walk. So if you're the patient and somebody is going to ambulate you, you're going to walk like you walk. You're not going to turn into a 90-year-old invalid. Okay? You're not going to pretend to fall. We don't do that. Everything needs to be uniform, consistent. If somebody is testing in Miami, somebody's testing in Jacksonville, and somebody's testing in Tallahassee, they have to have the same testing experience for it to be uniform testing. Does that make sense? So pleasant, cooperative, and you. Don't try to make this hard for somebody. Questions? So the evaluators are going to set the scene. And the patient, the person playing the patient, is going to follow the script. Good? Questions so far? After they read this care plan set to you and they tell you how long you have, so for this care plan set, you have 35 minutes. Once you get to 30 minutes, they'll give you a 5-minute warning. And then they're going to hand this over to you. So you've got it throughout your whole test. That means that if you can't remember something, you can go over and read it during the test. Remember, we're graded on following the care plan. We're not graded on memorizing it. Okay, good. Okay, so that's what this is showing you. The evaluator reads the care plan, then hands it to the first person testing, and then the thank you, Caitlin. I appreciate that. Yes, we congratulated Seiko earlier. So the evaluator reads the care plan, gives it to tester number 1, and then tester number 2 becomes the patient. After tester number 1 does all of their skills and ends their skills test, tester number 2 gets their care plan, and you would become the patient for them. Okay. Good. Questions? All right. So we have all 11 care plan sets. Remember, they're in your book as well. They're up here for you to be able to play with. At the bottom of ours, we'll tell you the time. We're going to get into skills timing a little later on in the program. I have a whole formula. I'm going to show you how they work that out. And the back of ours has the actual testing checklist as well. We've already been over this. Remember that each one of those care plan sets has an ADL skill, a documentation skill, and a mobility skill. Not necessarily in that order. But this shows you which skills are considered ADL skills. So these are all the skills we're going to learn in this class. Mouth care, denture care, hand and nail care, foot care, partial bed bath, peri care, catheter care, bedpan, make an occupied bed, and dress a resident with a weak arm. Those all fall under ADL. So you're going to get one of those skills. These are mobility skills. You're going to get one of these as well. Range of motion, there's 3 of them. Transfer from bed to wheelchair, ambulate with a gait belt, and change position to supported side lying. We're going to learn all of these. And you'll also get one documentation skill. Pulse, respirations, feeding, or emptying a drainage bag. So you're going to get one out of each one of those categories for testing. The back of our sets here have the checklist. You also have them. I'm going to go over that in just a few minutes with you. So when you're performing the skill for the test, the evaluator has the checklist and a pen. When you do a step correctly, you get a check mark. Yay. If you don't do a step, no check mark. If you do a step wrong, no check mark. So this is not a negative test where you get points off. This is a what we call positive step test where you only get credit for the things you do correctly. That's an important distinction because you're not starting out with 100 and subtracting. You're starting from 0 and adding. It's an important distinction. Make sense? Okay. So anything without a check mark is called a deficiency. This is a step that wasn't done or was done incorrectly. That's a deficiency. At the end of the test, the evaluator is going to enter all of your deficiencies into the computer. The computer is the one that's going to decide whether you passed or not. And it's going to be based on the importance of the step that you missed. Remember, I told you that my hardest job in this class is to get you to start thinking about things from the patient's point of view, right? It's all about the patient. Well, that's what this is all about. So let me explain how this works. Let's say that we need to do mouth care on this lady over here. Okay. So is she in a safe position for mouth care?
No.
Why?
She's on her back.
Okay, so she's laying down. She could choke. Yeah, the technical term for that is aspiration or breathing in liquid into the lungs. So we don't want her to aspirate. So what could we do to get her in a safer position for brushing teeth? Sit her up, yeah. However you want to do that is fine. You want to get her sitting on the side of the bed, go for it. She's a mannequin. She's probably not going to cooperate. So putting the head of the bed up would be the next best thing, right? So we think that's pretty important, isn't it? Because if the patient chokes, then they could die. And if we kill our patient for the test, we're probably not going to pass. Okay. Now, how many of you guys have brushed your teeth this month? Anybody? Good. Oh, awesome. Good. Okay, so when you brush your teeth, you probably stand over a sink. That means that all the foam and stuff drips down into the sink. You're probably in this position, not this one, right? So if we have a patient that's in this position, not this one, that means that all that foam and stuff is going to drop onto their shirt, clothing, gown, whatever they're wearing, right? Now, that hasn't ever killed anybody, but we probably want to prevent it. So we would put a towel over their chest to mop up anything that might drip. Make sense? So which one of those two steps do you think is more important? Head of the bed up or towel over the chest?
Head up.
Why?
Because they could aspirate.
Yeah, because we could kill them. Absolutely. If we kill our patient for the test, probably not going to pass. So we have to understand that each one of these steps is going to be graded on a weighted scale, depending on the impact to the patient for that particular step. Remember, I said the test is all about the patient, not you. So if you forget to put the towel over the chest, yeah, it's going to impact the patient, but they're just going to get some toothpaste on them. Nobody's dying. It's okay. If you forget to put the head of the bed up, oh, you killed your patient. Their family is probably going to, take offense at that. So every single step on the state exam is going to be weighted depending on the impact to the patient. Now, I'm plugged into a huge amount of CNA groups online, and I see this all the time, right? I just missed one step. Why did they fail me? So who is that focusing on?
Yourself, not the patient.
That's right. So the next question is, well, what step was it that you didn't do? And it's usually a big step, right? That's the only way one step would fail you. It's not about how many steps you get or don't get. That has nothing to do with the test. Nothing. It's how did your performance impact that patient? That's an important distinction for you to make when you're practicing. It's not about the steps. It's about the patient. Does that make sense? Does that help you guys a little? So when you're thinking about these skills, I want you to put your very favorite family member in your mind in that bed, whoever that is, your very favorite family member. For some of you, that might be mom or dad, but we have complicated relationships with our parents. So for the most part, it's probably aunt or uncle or cousin or sibling or something like that. Somebody that you really, really like. How would you treat them? Okay, does that make sense? If you do that, you will perform the skills well. Okay. So anything without a check mark is a deficiency. So we're going to perform the skill as directed on the, we're going to follow the care plan, the whole care plan in. Okay. Once we're performing the care plan, what are we going to look for?
Observe.
Observe for any abnormalities. And then we're going to report those off to the nurse. Oops, I got the wrong one. All right. Get off track here. Okay, there we go. So our skills grading, sorry, Caitlin, I got off track. So our skills grading, this is on page 65, explains to you how we're going to grade each one of these skills and how they're going to decide whether you pass based on your performance. Remember that it's not how many steps did you do? It's how important were those steps on the well-being of the patient. And we're going to concentrate a lot on that as we go through this course. So once everybody has performed the clinical test, they'll take you in a computer room to do the written. Usually it's clinical first, then written, but it may be written first. It depends on how many people are there to retest. So if you're unsuccessful at the test and you have to retake it, you're only going to retest the portion that you failed. So let's say that you passed the written and you failed the skills. You would only have to retake the skills portion. Or if you passed the skills and failed the written, you would retake the written portion only. You have to pass both sections within 2 years to be certified. Good? Make sense? Okay. So usually, in most cases, when people are retesting, they're retesting the skills, not the written. And that's why skills is usually first, because we're going to get those people out pretty quick. They've already done their full day. Let's get them tested and get them out. Okay. Good. Makes sense? So usually skills are first, then written. So once we're done with the skills, we will all go into a computer room and we will take a 60-question multiple choice test on the computer. These questions are pretty easy. I'm going to make sure you're well prepared for this test. Remember, it's all about our scope of practice. Most of these questions are scenario based. So they're going to tell you, you walk into a room and see this, what do you do? Right? They're scenario based. You'll be well prepared by the time I'm done with you. I also have a couple of practice tests for you along the way. We also have this book. This is a free ebook. You can download this. You just go onto my website, put your email address in, and download it. It's a PDF. It's workbook style, but it's going to help you learn how to answer the questions on the written test. So you go onto my website. It's foryourcna.com. There it is, foryourcna.com/ebook, and you can download that. You'll get a link in today's wrap-up email for that as well. So once you're all done with the test, you're going to get a couple of printouts. These printouts are going to look like this. So this is the printout for the written test. And it says, congratulations, you passed. Yay, good job. At the bottom, it's going to tell you the 5 categories of questions that they're testing you on, how many questions were in each category, how many you got right. Our students do very well on the written test. You'll also get a printout, looks very similar for the skills, looks a whole lot like it. It says, congratulations, you passed the skills. At the bottom, it's going to list the skills that you had. That'll go over onto the next page. The final page is the one I want you to pay attention to. That's this one. This is going to list all of your deficiencies. So this is what it looks like for the written test. I'm sorry, that's the skills. Oh, that's what it looks like for the written. And then this is the skills. You can see at the bottom, we have our skills listing. And then we get our item feedback or your deficiency list. I want you to pay attention to this, even if you pass. Because someday I'm going to be the body in the bed. I'm getting older. I am going to need healthcare at some point in my life. We all will. Now, do I want a good enough CNA? Or do I want a great CNA?
You want a great CNA?
I want a great CNA. I don't want a good enough. I don't want to, oh, you just barely passed, but hey, you're certified. Okay. Anybody know, this is a funny joke. Anybody know what they call a guy who graduates medical school last in his class? Anybody know? Doctor. He graduated. Do we want that guy as our doctor? Probably not. That's what this is all about. When you look at this deficiency list, you need to pay attention to the steps you missed. Every single one of these has an impact on the patient in some way. So you've got to pay attention to this. Good enough in medicine is not good enough. So look at your feedback and see, what did I forget to do? What did I miss on the state exam? And practice it so that when it really counts, when you're working on a real human, you're not forgetting these steps. You may have passed the test, but we want you to be better than that. Does that make sense? This is entry into healthcare. You're not showing that you've mastered anything. The bar is really low here, guys. Really low. You're not showing that you've mastered anything. But when it comes to me, I want you to master it. I want you to be the best CNA you can be. Okay? Make sense? All right. So when we're looking at the checklists for the test, and these are all the actual checklists right here. These are the actual checklists that they use in testing. All right there. I'm actually doing a research project right now. I am looking at all of the checklists for every state in the United States and comparing them. It's a huge research project. And it's amazing how different they are. You would think that they would all be kind of uniform. You know, CNA is a CNA. And they're not. They're very, very different across all states. In here, we're going to focus on Prometric, which tests in 13 states, including Florida. These are the checklists for Prometric. If you notice, step 1 is exactly the same for those checklists. Says exactly the same thing. Did the candidate greet resident, address by name, and introduce self? So that's going to show up on every single checklist there is. So our first step is to greet the resident, address by name, and introduce self. Step 2 is also exactly the same. Did the candidate provide explanations to resident about care before beginning and during care? So the question that we had earlier, do I have to say everything that you say? Well, yeah, because it's a checkpoint. And also the patient needs to know what we're doing with their body, not ours. At the end of the skill, you're also going to have checkpoints that are exactly the same. So what we did was put this in something that's usable for you. Every skill is going to start exactly the same way. It's called the opening. All the steps are exactly the same because all the checklists have those checkpoints on it. Every skill is going to end the same way with the closing. All of those steps are exactly the same. Okay, so we're going to learn the opening and the closing. Before we do, let's go ahead and take our break, come back at 5 after, and we're going to get into the opening, the closing, hand washing, and indirect care. So a lot of stuff to go over. Those of you, I know that we're here until 1. If you want to step out and grab something to eat or drink, you're more than welcome to. You can eat and drink in this room. There's no problem with that. Dump out any liquids before you put cups in the trash, though, for me, if you would. If you're a little late coming back, it's not a big deal. Just try to enter quietly so it doesn't derail me. All right? So go ahead and take your break and come back at 5 after.
at the nursing home, but I did activity. How about you?
It was a certified PT, so that it expired because I was working full time. And I had the job and also studying in college. So still studying in college.
I did medical administration. I love mine. Too.
Yeah, life happens.
Mm-hmm.
I feel like it's kind of what I learned almost 2 years ago. Just a repeat of it.
Good.
These papers look familiar. It's really 6 months of my classes. Some of them.
Patient care. Yeah, I did patrol.
I did blood, disease, and there's one more skill. Okay, I think take one. And I learned those, I guess. I wouldn't be able to do them anymore.
So when you do PCT, that makes you skip phlebotomy, right?
No, you have to take the line. When you do PCT, you do the same CNAs do, and then you do like a couple extra things, which some are optional, some are not. So like phlebotomy, you would have to do. And EKGs, you kind of have to know. Just because when you're technically they'll be a little bit more certified, more like up to the bar. Because you're supposed to like look at the EKGs, they definitely use still be able to we did the same thing. I'm sure when you get to like, if you like work at the hospital, probably they train you with it all. But no, I still don't remember how to do phlebotomy. At first, like when I do it, it's a little bit but like once you get the hang of it,
You like closing my eyes.
yeah, like this practice that and like it would kids would go anyway before they come out. I just first time that happened, we didn't see a cap at the end of it, so I was watching like, everything being laid out.
Yeah, I was watching a class online, but they practice on each other. I'm like, oh no. Like the first day we were doing. I was like, Yeah, really back in there. Uh-huh.
Alex, kind of did last year, it's kind of stuff, but it's like, but you weren't getting all that experience. You mainly do ST, and then when you did get the opportunity to like interviews, for people who almost do everything.
Yeah.
The hospitals, hospices, do it.
I was just trying to get them. Because I did actually be assistant. They were wanting me to be, what do they call it? Nursing. Or regular. No, don't. They was paying $9 for regular aid. But their CNA, I think they got paid 60. It's like, I'm not doing that.
Why would I want to take a pay cut? Mainly doing this like experiential PA school. I'm stepping up my laundry.
I don't know what I want to do.
Taking these classes, I'll study in college. Work.
But you go past it.
No, I read it. US stuff.
Oh. Is that all?
Yeah.
Dang.
And testing off just the visual test. Yeah, so I don't care anything else.
Okay, sorry guys. Tied up on the phone. Okay. All right, so welcome, Catherine from Qatar. That's pretty cool. These are all really cool places I'll never get to see. Okay. All right, so we're going, let's see here. Anthea asked, good morning, how many skills are required for the test? Well, if you're testing with Prometric, you're going to be assigned 3 skills. If you have our book, this book, you have this book on page 25, shows you the skill groupings. So 3 skills for Prometric. Other states are a little bit different. Come on in. All right, so we're going to learn how to do the opening. And the opening is what starts every skill that we're going to be doing. If you look at, this is the checklist for this particular skill. You can see another one here. I've got them all up here. All of these are up here. But if you look at this, you can see it, one of them here. If you look, you see green, 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 all of those greens. If it's green, it's a checkpoint that's going to be satisfied with the opening. Anything red is a checkpoint that would be satisfied with the closing. If it's purple, purple is skill rules. So that means we're following the care plan. So these are the actual checklists that they're going to be checking you off. But if you look at this one, you'll see that almost the entire thing is the opening, the closing, and following the care plan. There's only 1, 2, 3, 4, 5 steps that are specific to that skill. Everything else is opening and closing. If you look at this, you'll see pretty similar. A lot of red and green on there. And here, a lot of red and green, a lot of red and green, a lot of red and green. You'll see that about half of every skill is going to be encompassed by the opening and the closing. So we're going to spend a lot of time on this because it's going to count really big on the state exam. It's going to take care of a lot of your checkpoints. But remember, I said that it's not really about the checkpoints. It's about the impact they have on the patient. We've got to spend some time figuring out why each one of these steps is important to the patient. Okay. So remember that you're going to get 3 skills. Those skills are going to be read to you, and then the care plan is going to be handed to you. Then you will have to start the skill when you're ready. So they're going to give you a few minutes. They'll read that skill or that care plan set to you. They're going to hand it to you. You'll have a minute to review it. And when you are ready, you will say, I'm ready to begin. That's when your time will start. Okay, remember at the bottom of the care plan set, you'll have the amount of time that you have for this particular skill. Your skill time doesn't start until you start it. Okay. All right, so we have steps that we have to adhere to for the test. And remember, you're going to get a check mark if you do the step properly. If you don't do the step, no check mark. If you do the step wrong, no check mark. And each one of these steps is going to fall into a principle. So we're going to learn not just the steps, but the principles as well. So you can see that we have a lot of principles to learn. We've already learned skill rules. We follow the care plan, the whole care plan, and nothing but the care plan. We're going to learn the opening today. Glove rules we'll go over on Wednesday, along with barrier rules, privacy blanket, and we'll start on linen rules. We're going to go through the rest of these as we go through the program, and we're going to focus on the closing today as well. So by the end of today, you will know skill rules, opening, and closing. The rest of these are going to be covered as we go through the program. But think of them like building blocks. All washing skills are going to have the same steps. Doesn't matter what you're washing. Every time a patient's uncovered or undressed, you need a privacy blanket. Doesn't matter what the skill is. If we're turning a patient in bed, they have to be in the middle of the bed after the turn. Doesn't matter what the skill is. So these principles are going to cover all of the skills that we're going to learn. Okay? So think of them like building blocks. But there are 4 that we call the big 4 because they're present in every single skill. So for every skill we're going to learn how to do, we have to follow the care plan. Every skill that we're going to do, we have to do the opening. Every skill we're going to do, we have to evaluate if we need gloves. We don't use gloves for every skill, and we're going to talk about that a lot on Wednesday. Got a whole lesson for you on Wednesday. And every skill is going to end with the closing. So these are called the big 4. Doesn't matter what else we're doing, these 4 will always be part of every skill. Okay? And we're going to learn them all in detail. So you can see all of these puzzle pieces on page 27. And like I said, we're going to be learning them as we go. But all of them are listed there for you. So we talked a little bit about this, our scope of practice, the Happy CNA place. We know that everything we do is dictated by the care plan. We're going to do normal. We're going to follow our principles to tell us how. We're going to remember everything is always about the patient, and we're going to report all observations to the RN. When we get into the principles, don't forget that these things are really what's driving this whole program. And that's really important. We're going to come back to this again and again and again because you're going to start focusing on the details, and this is going to bring you back out to see the big picture. Okay? The two go together. All right. I do have flashcards. I forgot to print that off for you. I know I forgot something. Okay. So while you're enrolled in the program, I have flashcards there. This is what they look like. These are the flashcards. They're full color. There's flashcards for the principles, flashcards for the supplies, and flashcards for the steps. They all come in one pack like this. Normally, they're $24.99. As long as you're enrolled in the program, they're $14.99. So up until graduation day, you can get them for $14.99. You can make your own too, but this just is a very convenient way to review all the information that we're going over. So this is just for the classroom students. Those flashcards go down to $14.99. I also have a special on the practice kit for you as well. The practice kit, I don't have one in here, has everything you need to practice at home. Bedpan, drainage bag, gate belt, the whole 9 yards in a bag, carrying bag. And that's normally $65. I give it to you for $45.99 while you're enrolled in the program. We'll talk about that a little bit later on in the program too. But just know that you do get discounts on everything else that we offer while you're enrolled. All right, so let's talk about the patient experience. This is on page 21 of your book. This is the patient experience. When you are sick, Where do you want to be more than anything else in the world? Where do you want to be?
At home in bed.
Yeah, at home in my bed, right? What's your mood like when you're sick?
Cranky.
Irritated.
Yeah, grumpy, grouchy, cranky, irritated, just kind of blah, right? Just give me what I want, leave me alone. It's basically what I want when I'm sick. Absolutely. We have to remember that our patients are not going to be nice. They want to be home. If we are taking care of them, chances are they are not home. And that's where they want to be more than anything else in the world. And we are standing in their way. They also are probably a little preoccupied. Patients in the hospital all think they're dying. Just ask them, they'll tell you. They all think they're dying. So they're going to be preoccupied. What is this? What do I have? What's wrong with me? What does this mean? What am I going to not be able to do? Am I going to be able to go back to work? How am I going to afford this bill? Right? They're very preoccupied, but not just with themselves. They're also preoccupied with things in their home that they're not there to manage. Who's feeding my cat? Who's watching my kids? Is my cell phone bill going to be paid? I mean, they're preoccupied with things inside them, but also outside of them. So they're grumpy because they're sick. They're grouchy because they're not home. They're preoccupied with things inside and outside of themselves. Are you starting to see that this is not a good recipe for communication? I may say something to them and they may not remember what I said, or it may not penetrate because they're busy thinking about other things. They also might be medicated, which is going to affect communication. We need to be aware that when we're communicating with our patients, we are communicating at two totally different levels. So that means that I've got to slow down. I've got to look for recognition when I'm talking to somebody to make sure that they're paying attention to me, that they understand what I'm saying. I want to reflect back to them what they're telling me to make sure that I'm getting it. So we've really got to work on our communication with our patients and understand that we are not on the same wavelength as them. In fact, we are seeing them on their worst day. Does that make sense? We need to remember that when we're communicating. If we have a nice patient, that's a bonus. But we can't expect our patients to all be nice because they're going through a crisis. For us, it's, another day on the job, business as usual, but it's not for them. Does that make sense? Now, this is super important when it comes to things like privacy. Because when you get into healthcare, sometimes you can get jaded and you can think, oh, I've seen it all. I don't need to worry. She doesn't need to be covered. I've seen it all. You may have seen it all, but does that mean that she has shown it all to everyone? So we've got to be careful not to be jaded when it comes to healthcare. Again, it's taking us out of ourselves and thinking about things from the patient's point of view, not ours. Good. I was walking down a nursing home hallway years ago. Door is wide open. Privacy curtain is not closed. Patient is laying naked in the bed. CNA is bathing the patient. And I said, I just popped my head in and said, privacy. And she says, oh, she's got dementia. She doesn't know. Does that remove our responsibility to provide privacy? No, absolutely not. That patient, whether they have dementia or not, deserves decency, respect, compassion, and ethical behavior from us. Make sense? We've got to be really careful about that. These are things that the test is looking for. More importantly, these are things that's going to set us apart from just a caregiver, right? We have a moral obligation to do better. Make sense? Good. So we have to think about our communication attempts with our patients. The other thing that we have to think about is where they're at. So let's talk about hospitals for a second, right? Now, I have been very, very busy. I told you, I'm in the middle of this really big research project, right? And I'm working like 18-hour days. It's taking all of my brain power. It's a big, big, big deal. So I would love to call up and say, hey, I need about 3 days off. Can I reserve a room in my local hospital? I'd like massages every day, fresh flowers, catered meals. Are they going to do that? No. So hospitals are not a place that I can just, even though I need a little R&R, I can't pick up the phone and make a reservation at a hospital, right? How do I get into a hospital? How do you become admitted to a hospital?
Emergency medicine.
Okay, so most of us go through the ER, right? Do you guys know what the ER job is? Send you home. Their job is to not admit you. That is their job. Their goal is to get you stabilized and out. To get a bed in the hospital, you've got to prove that you are sick enough to deserve that bed. How many of you guys have ever been to the ER? Yeah. How many of you guys were admitted after a trip to the ER? Oh, they do their job really well, don't they? Okay, so their job is to not let you in. You've got to prove that you are sick enough to deserve a bed there. That's a high standard. That means that the sickest people in our community are all under one roof, and they all brought their pathogens with them. Every one of them. Now, that might seem like a kind of scary place for you, but you've got a healthy immune system. You're going to be just fine. You're washing your hands. You're taking your precautions. You're doing just fine. Do you know who's at risk? The other patients in the hospital. Because what ends up happening is she comes in with her pathogens. You take care of her, and if you don't do a good job with infection control, you're going to bring some of her pathogens over to this patient. This patient is already fighting something else. Their body is at war with whatever's trying to kill them today. If we bring another pathogen, there may not be enough immune system to fight two wars, and that can kill our patient. So who's the one at risk here? The patients. Absolutely. So we have to remember that when we're working in healthcare, it's a pathogen paradise, right? Lots of pathogens hanging around, but we're not the ones at risk here. The patients are, because they're already fighting something off. Make sense? Okay, super important. We also have to remember that patients are all different. So let me tell you a little bit about Grumpy. This kind of made me laugh yesterday. So yesterday I went to the big box store down the road. We won't say the name of it. Big box store down the road. And I'm looking at vitamin supplements. Okay. I was looking for potassium for my husband. He works outside. He sweats a lot. His hands cramp up. He needs potassium. So I'm looking for potassium for him. And right behind me on like a, I don't know, it's like a shelf thing, small shelf thing, was all the cold stuff, right? Because it's cold season. Like everybody's got something, right? So it's got, the cold medicine and the cough drops and all that. So my back is to that. I'm looking at where I need to, or no, I'm sorry. I was looking at the allergy medication actually. So the cough drops are behind me. There's a woman worker standing on a step thing to get to the top. Old lady comes up behind me and yells at the worker, "Where are the cough drops?" I mean, she is upset. And the worker says, "They're behind you." And I, because I'm listening, I turn around and sure enough, they're like right here, right? And this woman says, "So I passed them?" She's like, "Yeah, they're right there." Like right there, right there. And she's like, and she turns around and walks right past them. So I said, ma'am, they're down low. They're right here. And she's like, oh, she grabbed a bag of cough drops and marched off, right? And the worker's like, what a witch. Now, if she needed cough drops, that tells me that she's probably not feeling well. Where does she want to be? At home. Her concentration is probably affected, right? Because she's thinking about being sick and I just want to be home. And where is this thing that I need? And I have no patience right now, right? So was her behavior really out of character? Probably not. But it's all about how we look at it, isn't it? It's all about perception. Because I could have been, oh yeah, she was a real witch. But I understand where she's coming from. As healthcare workers, we have to step beyond the emotion to kind of see where they're coming from. It's not always easy to do. It's not. And some days you're going to be tearing your hair out and calling patients all kinds of names behind their back. But if we take just a minute to stop to think about where they're coming from, we might have a little more compassion. Does that make sense? Okay. Patients are all different. Just because we have 2 diabetic patients doesn't mean that both of those patients are going to require the exact same type of care, because people are individuals. So we have to understand that our care plan really is going to drive this. That if we treat all diabetics exactly the same, we're missing something. Okay. So remember that that's where that care plan comes in. That care plan is going to help streamline that care that we're going to provide specifically to that patient. Okay. So remember that all patients are different. You may have a couple of test questions that are scenarios like this. Remember that every care plan is specific to that patient, that our patients are all a little bit different. When you're taking the test, you're probably going to make a mistake. Probably. Almost assuredly. You're allowed to make corrections on the state exam. You make corrections at any time for any reason on the state exam up until you end the skill. So let's say that I am doing radial pulse. Remember, we read that care plan before, right? Take the radial pulse measured at the wrist for 1 minute and record our readings. So I do my skill and I realize at the end I forgot to close the privacy curtain. Just forgot. It just didn't even cross my mind. I could say, correction, I would have closed the curtain during my opening and open the curtain at the end of the skill. And now we're going to get a check mark for that space. So you can make corrections. Now they do need to see the step. So you can't just correct it verbally. They need to see it, but you want to tell them the order it would have been done in. Okay. So this isn't a do it right the first time or no extra chances. It doesn't work like that. You can make corrections. And I have seen people go from failing the test to passing it just by making a correction. So keep that in mind. You are able to correct. And we have a whole lesson on that on page 33. It'll explain to you what corrections are And again, when you see this, that tells you I have a video on that topic. I create a lot of videos, guys. A lot of videos. So you can make corrections at any time, but remember they need to see it. Remember they need to see it. So at the end of the skill, when you're all done, I want you to go back and read that care plan one more time. Because remember, the care plan is what drives this whole train, right? We have to follow the care plan. So you're going to do your skill, and then I want you to go back and read that care plan one more time and make sure that what you did is what the care plan told you to do. And then after you've done that, then you can tell the evaluator my skill is done. But be careful. Don't rush this. And a lot of people do. A lot of people rush this. Don't rush this. You need to take the time that you have, because if you say my skill is done and then you go, oh no, I totally forgot to, they won't let you correct it. Once you say my skill is done or my task is complete or however you want to say it, once you end that skill, you cannot go back and make corrections. They won't allow it. So take the time that you have. Okay. So it's a good idea to reread that care plan before. And you do have to perform the steps. So let's get into how we're going to go through this program. So we're going to talk about the syllabus here. This is our syllabus. You can see it here on the screen. The first column, so you'll see it's rows and columns. Okay. So the first row is today. Today. The columns mean something different. So if you look in the first column, it says in-class skills. So that means that we are going to learn skill rules. Well, we did that already. We perform everything as directed on we follow the care plan. It's the care plan, the whole care plan, and while we're doing that, we're going to make, and we're going to report those. Okay, so you can check that off. We've already done that. Okay. We're going to learn the opening, the closing, hand washing, and indirect care. So we still have a long way to go. The second column are the lessons that I'm going to go over in that class. So we talked about the CNA exam. We've already done that. We talked about delegation and liability. We've talked about patient considerations, testing care plans, and all of those puzzle pieces that we're going to learn. So we've already done those. But there's lessons here that you can go back and review. The third column is dreaded homework. We're going to get to that in just a minute. And the fourth column is additional activities. So we went over the 5 key phrases. We did the care plan activity. We've talked about corrections and skills grading. We still have to do warm, dark, moist. We'll get there in just a little bit. So we've covered a lot of information today. And this is just kind of your roadmap to be able to go back and review that information as you need to. Good? Questions? So let's talk about the third column there, homework. So when it says the yellow textbook, this is the book they're talking about, the yellow book that you have in front of you. You're going to return this on the last day of class. So don't write in it, highlight it, make notes in it. It's not yours. It's going to come back to me. You can order this online, you know, the big A. You can order it online if you want to. Get it through them, not me, because I'm going to charge you way more than they do. So remember, you will be returning this. But guys, if you do your reading like I'm asking you to, you'll never look at this book again. It will be a very expensive paperweight. You don't need to keep the textbook. Keep up with the reading. So you're going to go home tonight and read chapter 1 in that yellow book. Chapter 1. Once you've taken or done the reading, you need to take a test just to kind of see, did you get what you needed to get? Did I learn what I needed to learn? And that is going to be in your white book on page 181. So if you turn in your white book to page 181, you'll see that there is a test there. 10 multiple choice and 10 matching. The matching is going to be based on the vocabulary from that chapter. Now, just because you took a test doesn't mean anything. We got to grade the test to make sure that we understood the concept. So the very last page in the book, page 201, is going to be your answer key. So to recap, we're going to read chapter 1 in the yellow book. We're going to take the test on page 181 in the white book. Oops. And then we're going to grade it using page 201. Good? Questions? Down here is your grading scale. If you miss 0, you got 100. If you miss 1, you got a 95. 2 is a 93, and so on. So you can tell me when you come back into class on Wednesday, I'm going to go write down my list here, and I'm going to say, Victoria, how did you do? Janelle, I'm just going to read your names, and you're going to tell me I missed 1 or I got a 95. Okay. I don't check. This is the honor system. You can lie to me, but it's not going to do you a bit of good on the state exam. So there's responsibility on your part here. What these grades do, they don't mean anything. What they do is let me know who's struggling. If you're telling me that you're getting 70s on these tests, I know that you're struggling with some of the concepts. And that just tells me to dig a little bit deeper and figure out where your problem is so I can explain it in a way that you can understand it. The book does a pretty good job explaining stuff, but some of it's a textbook. Some of it's very dry and boring and so you may not get what you need out of it. So if you're giving me scores that are low, it just tells me I need to take some time to reframe this for you. Good? If you're telling me that you're getting hundreds all the way across, I know you're good. I don't have to worry about you. Okay, good. Some of you are going to be tempted just to take the test without doing the reading, and that's fine, but that's just going to show you that you know what you know. It doesn't really highlight what you don't know. You may have learning gaps that you're not aware of. I would do the reading. Okay, so let's learn how to use this study guide. So every skill that we're going to learn is going to have a principle page. So this gives us an overview of the skill itself. So if you look on page 52, this is an example of the pulse page. So if we look at this page here, you can see that measure, record radial pulse. These are our test specific steps. These are all the principles that we have to perform for successful completion. So we're going to follow the care plan. We're going to do our opening, evaluate if we need gloves. We're going to do these steps here, and then we're going to do our closing. So this is our building blocks. This is what we're going to follow. Of course, I have a video for this. You can watch the video. And then down here is test specific information. So somebody with your level of experience should be able to do this within 5 minutes. So along the side, I'm going to take you through this step by step. Along the side are the steps involved in this particular skill. Now, some of these are way more intensive. Keep your finger there for a second, but go to page 126 and look along the side. Notice that this only has 5 of the puzzle pieces highlighted. If you look on page 126, you'll see almost all of them are highlighted. You guys see that? We got a long way to go before we can learn partial bed bath. We got a lot of principles to learn first. Okay. So this gives you an overview of the steps involved. This is going to detail those steps. We have a short form here that kind of gives you the Cliff Notes version and skills specific steps. We have a video and we have test specific information, including timing, who your patient's going to be. Sometimes it's a testing person, like here, testing student. Some skills are done on a mannequin. So whatever you see in that space is who you'll be doing it on for the test. It'll tell you where that person needs to be, a bed or a chair, and it's going to tell you if documentation is required. Remember, we have 4 documentation skills. Good? All right, so go to page 53. So 52 was our overview, right? Think of it like a Cliff Notes at a glance. 53 is going to get into details. So at the top of the page, you have the actual care plan from the state exam. And we've seen this one before. Patient will be lying in bed for skill. Take the patient's radial pulse, measure out the wrist for 1 full minute, and record your readings. We've seen that before. That is the actual care plan from the state exam. Oops, where'd it go? Actual care plan from the state exam. At the bottom of the page, you're going to see the supplies needed for this particular skill. So we need a clock, we need a pen, and we need a documentation form. There's a lot of supplies. This is a very easy one. A lot of these skills are going to require a lot more supplies, and you have to learn the supplies. Nobody's going to tell you, hey, I need you to go do a partial bed bath, and you're going to need a basin, soap, lotion, 4 washcloths, 2 towels, a clean blanket, or a clean gown, and a privacy blanket. Nobody's going to say all that. They're just going to say, go give a partial bed bath. You have to know your supplies. This is where those flashcards are going to come in handy. But you've also got them at the bottom of each skills page, so you can make your own flashcards if you want. Oops. Okay. So remember I said we have these checklists that the test is going to use? What I did is I used this checklist to create your step-by-step instructions. So you can take this book home to any live human that you have laying around. Find a live one. Dead ones won't help you. Need a live one. And you can hand this book to any of your live humans, and you can say, hey, I'm learning this skill, but I don't know the steps yet. Can you read each one of these steps to me? And when they read the step, you do it. They read the step, you do it. They read the step, you do it. That way you're always practicing as if you were being tested. Exact steps that are required. Good? Now, after you've done it once or twice, you don't want somebody to read this to you. Now, you want them to watch you do the skill and read along to see if you missed anything. So you can create your own evaluator at home. Now, the reason it's in this format and not this format is because this is written for RNs. This is written for the people who are going to test you. That's not going to help you because you don't have an RN brain. What I had to do was filter this into clear steps that you can follow. Good? Make sense? Does that help you? Okay. So you're going to see me demonstrate the skill. When I'm demonstrating the skills, you can follow along in the book to make sure that I'm hitting every single checkpoint there is. And then you've got something to practice with when you go home. Have you guys ever in school, did you ever go to a place or go to a class and they told you to go home and practice something? So you go home and you're like, I don't know what I'm doing. I have no idea. How do you practice when you don't know what you're doing? it causes a lot of confusion. That's not a good way to practice. Practicing with intention is different, and that's what this book is going to help you do. You're going to practice with intention. Good? That way you don't develop any bad habits because they're out there. Now, I have a whole course for you, and all of you will be enrolled in this course later today. You're going to get an invitation email from me, and it's going to come from For Your CNA Courses. When you get that email, you just click on, there's a little box that says Accept Invitation. So you're going to accept your invitation to the course. It's going to take you over to the course. You create an account. It's free. And it's going to put you into my online course. Now, the online course has a lot of what I'm going through in class, but it also has a lot of interactive elements to it. So it allows you to kind of practice before you practice. So some of the things that you'll see, I don't have it in here. Some of the things you'll see are supply gathering activities. So it'll show you all of the supplies, and you have to click on the ones that you need for that skill. So it's a great way to learn the supplies. You'll have sequencing activities, which we're going to get to in just a few minutes, where it shows you all the steps and you put them in the right order. It's got a ton of practice questions. It's got flashcards. It's got all kinds of stuff to help you put into practice what you're learning in class. And this is included in the program. You may not make use of this so much while you're in class because you've got me live right here. But this is going to be important to you after graduation before you go test, because you probably will have a couple of weeks between graduation and testing. And this will help you remember what I've said, but also be able to practice what you've learned. Okay, so let's learn about the opening. Now, the opening is going to be found in every single skill that we are going to learn. So page 30 is going to show you the opening steps, as well as all of the skills that are going to require that particular principle, which in this case is all of them. So here are our steps for the opening. Okay, the order matters here. The order matters a lot. So every skill starts with the opening. Every opening starts with a knock. Now, that's going to be important. I'm going to say that again. Every skill starts with an opening, and every opening starts with a knock. That's going to be important because on testing day, when you get your skill list and it is now real, and they read this to you and then hand it to you, do you know what your brain is going to do? Freeze. Everything will go out of your brain. You won't even remember your own name. And you're going to be like, what do I do? I don't know what to do. Every skill starts with an opening. Every opening starts with a knock. If you can remember that, and you're going to hear me say that about 30 times. If you can remember that, every skill starts with an opening. Every opening starts with a knock. You can at least get to there. Okay, so when your brain goes absolutely blank, you will have a starting point. Because once you knock, that first step is taken, you can roll into your opening then. It opens the door for the opening. Does that make sense? You will freeze on testing day. You will. Because you're being tested and now it's real. So we've got to have strategies to help get you over that initial, what do I do? So every skill starts with an opening. Doesn't matter what our skill is. Doesn't matter what's first on this list. Every skill starts with the opening. Every opening starts with a knock. So you know the very first thing you need to do is knock. Okay? But let's talk about why. Because for me, it's not enough just to teach you the steps. You need to understand the why behind the steps so they become important to you. Okay? So let's talk about why. Well, when you have a patient, remember we talked about patients, right? They're grumpy, they're grouchy, they're self-absorbed, they're preoccupied, right? They're all those things. Well, they are in an unsafe space. They are in a room, usually with the door wide open, a roommate that they don't know. They didn't get to pick their roommate. There's a stranger laying 6 feet from them. Do you think they're going to be able to sleep very well? Now, what's the one thing that you need when you're sick? Sleep, rest, absolutely. So we take the sickest people in our community. We know they need sleep, and we put them all in one place, leave the door open, and give them a stranger 6 feet away. They're not going to be able to sleep. That's going to make them even grouchier, by the way. Fun. Now, let's imagine that they do close their eyes and they are able to kind of drift off finally, and they hear a sound. And they open their eye, and there is a stranger standing right over them with a sharp object in their hand. How are they going to react? What?
Terrified.
Frightened, terrified. Yeah, I'm hitting first, asking questions later, because clearly you are a threat to me. Right? So we have to understand how our approach is going to be interpreted by that patient. They're already sleep deprived. And now, if they have strangers walking into their space, they are going to feel very insecure. That is why healthcare workers must knock before they enter. It's not a nice thing to do. It is the only thing to do. Does that make sense? You never enter a patient's space without knocking to let them know that you're coming in. Ever. That's a violation of their rights. Does that make sense? It's a huge deal. So yes, every skill starts with the opening. Every opening starts with a knock. That tells you where to start, but it's way more important than you. It has everything to do with that patient. The patient needs to feel somewhat secure in that space. And if they just have random strangers in and out of that room, and guys, most of the people in healthcare hurt the patient. Do you guys know that? Most healthcare workers hurt patients. Phlebotomists will stick you 15 times before they draw blood. Nurses start IVs. Those are not pleasant. X-ray techs put you on hard surfaces in impossible positions to try to get the right view. Doctors do all kinds of exams in all kinds of places that are not comfortable. EKG techs put those little sticky tabs on and then rip out every hair you never knew you had. Okay. So we have to remember that and then billing. Oh, they're the worst of all. They really hurt because healthcare is not free. So we have to understand that almost everybody that walks in that room is going to hurt that patient in some way, except for CNAs. But do you think your patient knows that? We don't hurt patients. Not our job. But our patient isn't going to know that because we're all dressed alike. We're all in pajamas. As far as the patient's concerned, we call them scrubs, but the patient sees them as pajamas. Okay. So we need to understand how we approach this situation is going to impact how our patient responds. Does that make sense? So every skill starts with an opening. Every opening starts with a knock. And that's important for patient rights. Now, for the test, we don't have to wait for a come in. If we get one, great, no problem. If we don't get one, it's okay because there's something called an open door policy. If the door is open, we're still going to knock. That's a courtesy, but we don't have to wait for a come in because the door is open. If the door is closed, you need to wait. Think about all the things you do behind closed doors. Think about all the things you do behind closed doors. Your patient may be engaged in any one of those things. And there are some things that you cannot unsee in life. So if that door is closed, you need to knock and wait. If you don't hear anything, knock again. If you still don't hear anything, open the door a crack and say, hey, it's a CNA. Can I come in? If you still don't hear anything, go in because there's a problem. Okay. But we've got to give them at least 3 opportunities to say, not dressed, not decent, please wait, whatever they're going to say. 3 opportunities. Good? Questions? All right. So once we enter the space, we need to identify our patient. Okay. Once we enter that space, we need to identify our patient. And we're going to greet our patient by name. That's how we're going to identify them. For the test, we do not have ID bands to check. There are no ID bands. And that's because the majority of patients are not in a place where ID bands exist. When you are at home, in your home where you live, do you have an ID band to tell everybody who you are? Why? Yeah, it's home. They should know me, right? They should know me. I live here. Yeah. If not, there's a bigger problem. All right. So in your home, you do not have ID bands. Assisted living is where a patient lives, so they will not have ID bands. Nursing homes are where a patient lives, so they will not have ID bands. Yeah, home care is where the patient lives, so they will not have ID bands. In fact, the only places that you will see ID bands are in hospitals, short-term rehabs, and same-day surgery centers. Out of all of the places that healthcare occurs, that's where you'll have ID bands. So we can't rely on ID bands as a way of identifying our patients. When you're at the doctor's office, you don't get an ID band. You get put in a room, and a chart goes on the door outside. And when that healthcare worker comes in, they don't ask for your ID band. They just look at the chart and they say, what's your name? Zachary? Okay, this is Zachary. Say hi, Zach.
Hi, Zach.
Can I shorten it to Zach? Is that okay? Okay. All right, so this is Zach. So if he's in a doctor's office as a healthcare provider, I walk in and I say, okay, hello, Brian. How are you? What's his name?
Zach.
Okay, so if I walk in and say, hello, Brian, what are you going to say? Okay, because you don't want what I've got in store for Brian, do you? Probably not. All right, so patients are able to self-identify. And in most healthcare settings, that's the safest way to identify your patient is by name. Now, I know some of you are going to be like, well, wait, what about dementia patients? As the nurse, when the patient comes in, I do a head-to-toe assessment. I'm looking at all real problems and all potential problems. If that guy over there can't identify himself, that is a problem. So I need to have something on the care plan that tells you how to identify that patient. So the system is already in place for that. Make sense? Okay. So for the test, our patients are able to self-identify. So we're going to knock, always step 1. Hi, Mrs. Jones. Now, for the test, we're going to use just one name, Mr. or Mrs. Jones. It just makes it easy. You don't have to learn everybody's last name. You can use Mr. or Mrs. Jones or whatever name they give you at the testing center is fine. Usually it's Jones. Okay. So, hi, Mrs. Jones. Good. That's the beginning of our opening. Knock, knock, knock. Hi, Mrs. Jones. Now, I know it's cold. Once I've done that, knock, knock, knock. Hi, Mrs. Jones. You have to tell them who you are, but not just who you are, what you are. You need to introduce yourself by name and title. So if I just walk in and say, hey, I'm Patty. So, Patty who? Patty, the person that brings cookies? I like that, Patty. Patty, the person that brings a needle? Not so much. Okay. So you can't just tell them your name. You need to identify yourself by name and title. So, hi, Mrs. Jones. My name is Patty, and I'll be your CNA today. Good. Now, somewhere in there, I like to throw in a, how are you today? How are you feeling? How's your day going? Something along those lines, because I'm getting ready to do a skill. The whole reason I'm in there is to do a skill. I want to know, like, right away if I can't do that skill. Now, if I can't do that skill, who would I tell? The nurse, right? So rather than waiting until I close the curtain and wash my hands and get my supplies and get everything set up, and then he says, oh, I'm nauseous, I really don't want to sit up. That's a lot of wasted time. So it's better if I say, hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you? If he says, oh, I'm nauseous and dizzy. Oh, no. Let me go get the nurse. Way better than doing everything else, finding out he's nauseous and having to stop and go get the nurse. Make sense? So finding out how your patient is can save you a ton of time on the back end if they're not doing well. For the test, remember, they're all going to be pleasant and cooperative, which means they're going to say, I'm fine. But it's nice to have that in the opening. Okay, so far we've got every skill starts with an opening. Every opening starts with a knock. Hi, Mrs. Jones. My name is Patty. I'm your CNA today. How are you? Then we're going to tell them why we're there. Insert name of skill here. Okay, I'm here to give you a partial bed bath. I'm here to take your pulse. I'm here to ambulate you to the bathroom. I'm here to, whatever your skill is. Now, you can put it in terms that are comfortable to you, or you can read them right off of the care plan. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to measure and record respirations. Okay. You can read it right off the care plan if you want to. Or you can say, I'm here to take your vital signs. Good. However you want to term it is fine. But then we're going to ask the most important question in healthcare. Is that okay? Every patient has the right to refuse care. In fact, they have the right to refuse any care at any time for any reason. If I'm halfway into a skill and they say stop, I am hands off. No problem. Got it? No means
No.
it doesn't matter where the person is. Just because they're in a healthcare facility does not give me the right to touch somebody without their permission. In fact, touching somebody without their permission is called battery. And I can be charged, even as a healthcare worker, with battery for touching somebody without their permission. So let me give you an example of this. Will make a little more sense. How many guys go to the movies? Anybody go to the movies? Yeah. Okay. So what's your name?
My name's Kiara.
Kiara. Okay. So Kiara, you go to the movie. You get your big thing of popcorn and your soda, and you sit down. And I come in 5 minutes later, and I sit down next to you, and I start taking your shoe off. Now, you don't know me. I'm some stranger. And I start taking your shoe off. You're probably going to ask, what are you doing? Stop. Oh, no, it's fine. I've got to do foot care. It's fine. Just watch the movie. It's fine. I'll do foot care. Now, you don't know me. I'm just some stranger off the street taking your shoe off in a movie theater. How many of you guys think that's a little weird? How many of you are calling 911? Get this weirdo away from me. There is no difference between that scenario and me trying to perform foot care on somebody who doesn't understand what I'm doing in a clinical setting. The only thing that changed was the building. You do not have the right to touch anybody without their permission. And to your patients in a clinical setting, what you're doing is just as creepy as me doing foot care on Kira if she doesn't understand what I'm doing. Does that make sense? So a big part of what we're going to do is make sure that our patients understand what we're doing. And that means we may have to explain it a couple of different times in a couple of different ways. But we've got to get them to agree to what we do. Good? Make sense? So obtaining permission is super important. Once I've done that, hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I need to do foot care. Is that okay? All right, I'm going to go close your curtain. Now, the reason, let me see if I can get this to work. Hold on. Give me a second. Yay. Okay. All right. So the opening, let's pretend we have a body here. We'll just pretend. Okay. The opening would be like this. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I need to do foot care. Is that okay? I'm going to close your curtain and then go wash my hands. Now, I'm telling her I'm going to leave to go wash my hands. I actually say it. I'm going to close the curtain and go wash my hands because I just told her I'm going to do a skill. I'm going to do foot care. Is that okay? Now, if I just close the curtain and walk away, she's not sure if she's supposed to follow me. Right? She's now, well, wait a minute. You just said, what am I doing? I don't, it's a lot of uncertainty, right? But if I say, hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to do foot care. Is that okay? All right. I'm going to close your curtain, go wash my hands, and I'll be right back. Now she knows that there's nothing that's required of her. Make sense? Okay. So telling the patient what you're doing is a big part of what we do. Now, the problem is that for you, it's going to become very routine. You do the same thing over. Remember, that opening is done before every single skill. You're going to do 456 skills a day, right? So for you, it's very routine, and you might try to cut some corners. But remember, this isn't their 456 skill today. It is their first. Make sense? Okay. All right. So let's talk about this curtain real quick. Who touches this curtain?
CNA.
Okay, nurses, CNAs, doctors, patients, visitors,
Everyone.
everybody. Everybody touches this. The visitors in the elevator pick their nose and they touch this curtain. Patients in bed scratched what it is and touch this curtain. Nurses emptied the drainage bag with gloves on and then poured the patient a cup of water and handed it to them and touched this curtain. Yeah. Is this curtain clean? No. So when you touch this curtain, what do you think the next thing you'd like to do is?
Wash your hands.
Wash your hands. That's right. Because remember, I said the person at risk in this scenario is the patient. And we're getting ready to do a skill on that patient. So if we close that curtain, touch that curtain, and don't wash our hands, we are transferring all of those patients to all those pathogens to the patient. Does that make sense? Okay. We've got to be really, really careful about infection control when it comes to the patient. We're going to talk a lot about that with gloves on Wednesday. Okay. So everybody good with this? Okay. So one more time. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I need to do insert skill here. Is that okay? Awesome. I'm going to close the curtain. Let me go wash my hands and I'll be right back. Now I'm going to go wash my hands. Good. Questions? Questions? Okay. So let's see if we can remember all of these steps. You see this one right here? So what do our hands have to be before we touch patient? Clean. That checkpoint right there is enough to fail you on the state exam. Touching a patient before you've washed your hands is enough to fail you. That's right, because remember, your patient is the one at risk. Okay? Good? All right, remember I told you guys that you're going to have access to the online program after today? So this is the lesson from the online program. Okay, you can see, puzzle out the opening. We just learned the opening. And there's a video there. You press the play and you watch the video if you want to. That's fine. And then you're going to see this below the video. This is a drag and drop sequencing activity. And we're going to do this together in class now to see if we can get this right. Okay, so let's see if we can figure out the steps. So here's our steps. This is because I know some of you can't see. So the first thing there is gather supplies, close privacy curtain, read the care plan, identify patient by name, knock on door, wash hands, explain task, and ask if okay, and say your name and title. Out of these, which one do you think is first? Who said care plan? Very good. Yeah, every skill starts with, how do we know what to do with each patient? Every skill starts with the care plan. Yeah. So I've been saying every skill starts with the opening, but remember the care plan is always before the opening because we need to know what skill to do with that patient. Okay, so now that we've read our care plan, what's our first step? Knock. Okay. What's our next step?
Patient by name.
Okay, identify our patient by name. Okay, now what do we want to do? Okay, your name and title. Okay, what now?
Explain task and ask if okay.
Okay, explain task and ask if okay. Now what do we want to do? Close privacy curtain. And then wash your hands. We can't get our supplies until our hands are clean. Very good. All right, so now let's hit the check button and see if we got them all right. Yes, we did. We got a gold star. Yay, us. So you'll see this type of activity for every single skill that we're going to learn how to do. This was the opening, gave us all the steps. But as we get into the actual skills, you're going to have all of the steps of the skills laid out, and you can put them in the right order. It helps you learn the steps and learn the order as well. So the online program will be helpful for you. Any questions on the opening? Okay, now we're going to jump over to the closing. The closing is how we end every single skill. So you'll see this on page 34. This is the overview. Notice that the closing is featured in every skill. And page 35 gives us all of our particulars. Now, if you look on the back wall, you'll see green is a little short, red is a little long, right? So there's a whole lot more steps on the closing. You can see it. Let me go back a page. You can see it here too. Whole lot more steps on the closing than there were on the opening. The difference is the order of steps on the opening matters. So the order we do that opening matters. The order of the closing doesn't, except for the last two steps. Okay. So the order of the opening matters. You can't touch your supplies until your hands are clean. You can't clean your hands until you've closed the curtain. You can't close the curtain until you've gotten permission. You can't get permission until they know what you're doing. You can't tell them what you're doing until they know who you are. And you can't tell them who you are until you know who they are, right? So all of those steps matter in the order. Good. Closing, not so much. The closing are all C's. It's the easiest way to remember it. All the steps of the closing are C's. So the first is clean environment. Okay, we got to make sure the patient's in a clean environment. So this means you need to look around. You know, is the sheet nicely over the patient, or is it hanging on the floor, all wrinkled, whatever? Is the overbed table cleaned off? You know, is the environment clean? We want to look at that. It's very important because patients rest better in a neat, orderly environment. When there's a lot of chaos and confusion around, it can actually trigger anxiety and make it harder for the patient to rest. So clean environment, and believe it or not, this is a CNA responsibility. A lot of CNAs think that this is housekeeping. It's actually not. This is a fundamental CNA responsibility, making sure our patient's environment is clean. Housekeeping helps us out. Just like the curtain. We know that curtain isn't clean, but housekeeping does spray it with a disinfectant spray in between patients. That's nice. It's not great, but it's nice. I'm still going to wash my hands after. Do you know those curtains are only taken down once or twice a year and actually washed? Yeah. Yep. Pretty cool. All right. So clean environment. Along with that, we've got to look around for safety. So while we're looking at clean, we're also going to be evaluating safety as well. Clean and safe goes together. So one of the things that we want to look at here is bed height. Okay, bed height. Now, what I mean by that, your beds at home probably don't do this, but this bed right now is in the low position, but I can raise it by pressing a button to make the bed come up to a comfortable working height. Now, this bed keeps going and going and going, and it almost resembles a bunk bed by the time it stops. See how high this thing goes, right? All right. So I can raise the bed to a comfortable working height so I don't have to bend over. And there's nothing wrong with that. You can do that for the test. If you want to raise the bed for any skill, knock yourself out. Perfectly okay. But what I actually did here, even though you saw me raise the bed, what I actually did is move the floor. When you go to bed at night and you swing your legs into that bed and you go to sleep and you're out for the count, when you wake up in the morning and you swing your legs out of bed, that floor has never moved a day in your life. That floor is always right where you left it. Predictable. Floor is right there. So you don't even think about it. You swing your legs out and you stand up because the floor is right where you left it. But if I raise this bed up, I've moved the floor. This patient is expecting that floor to be right where they left it. So they're not going to see if the floor is there. They're going to swing their legs out and stand up as if the floor was there. And what's going to happen? They're going to fall. Has nothing to do with them rolling out of bed. It has everything to do with the fact that I moved the floor. So at the end of the skill, I have to make sure that this bed is exactly where it was in the lowest position as I found it. That is a critical checkpoint. If you raise this bed up to a comfortable working height and you do not lower it at the end of the skill, you will fail the skill. Not because you forgot a step, but because the impact on the patient is huge. Make sense? Okay. Forgetting a step has nothing to do with you. It has everything to do with the impact on the patient. So while we're looking around at our clean environment, we're also going to be evaluating safety. So is that bed in the lowest position? Good, clean and safe. We also want to ask the patient, are you comfortable? They need to hear that word for the test. Are you comfortable? Now, comfort has two parts to it. Most of us don't really think about this. Comfort is physical comfort, certainly, but it's also emotional comfort. If I gave you guys 2 minutes just now, if I said, okay, we're going to take a 2-minute break, do whatever you want to do, 2 minutes. What are all of you guys going to reach for? Your phone. Absolutely. Why? Why? Okay, it brings you comfort. It's something to do, right? It keeps you entertained, occupied, right? Yes, socially interactive. Absolutely. If I told you you had 2 minutes, you would not all sit here and just stare at each other. You would pull up your phone, you'll flip through your book, you'll talk to a neighbor. You are not just going to sit here and stare at a wall. So don't expect your patients to. Comfort is emotional as well as physical. So that means that we need to address both. We're going to ask, are you comfortable? But I'm also going to ask, would you like a magazine? Would you like the TV remote? I'm going to find out what the patient needs for emotional occupation, emotional comfort. If you leave a patient isolated in a room with nothing to occupy them, they will start fixating on whatever is wrong with them. They have nothing to distract them, which means they're going to be on that call light every 5 minutes. So this helps you as much as it helps them. Okay. So for the test, we're going to show that we understand this by offering a magazine. So the closing is clean and safe environment and ask about comfort. Part of comfort is offering a magazine. Good so far? Clean and safe, comfort. The next thing that we're going to do, and we can also adjust the head of the bed for comfort if they request it. Next thing we're going to do is curtain. We have to open that privacy curtain. Now we know that curtain is not clean. That's okay. We're going to wash our hands in just a minute. But that curtain is the patient's cooties. Okay. They've coughed, they've sneezed, they've scratched, but it's just their cooties. So we can hand them the call light after the curtain. It's okay. That call light is not clean either because the patient has touched it. So these 4, the order doesn't matter. Nobody cares. Clean and safe, comfort, curtain, call light. The order does not matter. But once we've done all of those things, then we want to go wash our patient's cooties off our hands. So we're going to go wash our hands. So good so far? If we have to chart something, remember we have 4 documentation skills and you will get one of them. That means for the test, you are going to chart something. If we have to chart something, it's going to come at the very end after we've washed our hands because we cannot touch this pen until our hands are clean. That pen goes in your pocket. It goes home with you at the end of the day. You cannot touch the pen until your hands are clean. So you would chart after hand washing. And then remember with, let me go back. Oh, I can't. Okay. Do you remember with the opening, we had that one, the very last one I said was super important. Don't touch patient until hands are clean. You guys remember that? Well, the closing is just like that. End skill with clean hands. So if we've documented and we've touched our pen, what do you think we need to do? Wash our hands again. End skill with clean hands. So our closing is much longer. I always like to start the closing by thanking my patient because they're the reason I have a job and a paycheck. Okay. It also helps your patient feel needed and wanted. So I do my closing. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? I'll explain that in a minute. Are you comfortable? Your environment is clean. Your bed is in a low position and safe. Would you like a magazine before I go? Here's your call light. I'm going to open the curtain and go wash my hands. Document if necessary and wash my hands again. That's your closing. So thank you very much, Miss Jones. Is there anything else I can get for you? Are you comfortable? Would you like a magazine? Your environment is clean. Bed is in a low position. Here's your call light. Open the curtain. Clean my hands. Chart if necessary. Clean my hands again. Way longer. But if you remember, when we looked at these, look at all that red. See all that red? See all that red? See all that red? Those are all steps that are covered by the closing. So every single one of those checkpoints is important. Thank you very much, Ms. Jones. Is there anything else I can get for you? Are you comfortable? Would you like a magazine before I go? Environment's clean and safe. Here's your call light. Open the curtain. Wash your hands. Now, it doesn't matter what order you do that in, other than hand washing and charting and hand washing. You want to give them the call light first? That's fine. You want to open the curtain first? Go for it. You want to talk about a clean environment first? Cool. Nobody cares. Good. You just have to hit all of those points. But let me tell you why I ask them, is there anything else I can get for you while I'm here? Remember I said patients are self-absorbed, right? They're kind of focused on themselves. Well, here's the problem. And I've seen this a million times in my career. So I've got Mary over there and she's laying in bed and she's got nothing to distract her from her woes. And she's laying there covered in a thin sheet. Now, the temperature in here is different for me than it is for you because I'm up moving around. So what do you think the temperature probably feels like in here for me? Yeah, it's warm. Yeah, you guys are all like bundled up because I turned the air on and you're like, oh, it's cold, right? So your temperature difference is real. How do you think she feels over there in a thin hospital gown with a sheet on?
Freezing.
Oh, yeah, she is cold. Absolutely. But if I'm in a hurry and I'm trying to rush through my skill, right? Do you need a paper towel? You okay? Okay. If I'm trying to rush through my skill and just get done and get out, all right, thanks, Miss Jones. You need anything else? You're comfortable? Good. Bye. Okay, here's call light. Go. I'm out. Right? She's not going to feel like she can voice any of her concerns because I'm in a hurry. So she's now laying there and she's cold and she has nothing to distract her, nothing else to focus on. So she is cold and she is really cold. And now she is freezing and she has nothing else to think about but the fact that she is cold. So after about 5 minutes, she's going to hit that call light. And she's going to ask me, can you get me a blanket? Now, she interrupted me because I was in the middle of another skill with another patient. But no problem. I'll go get you a blanket. So I wash my hands, go get her a blanket, bring it back, wash my hands again, and I go back to my patient that I was working on. And now she's covered, cool. But she's laying there thinking, you know what? I'm really thirsty. Man, I'm really thirsty. And my cup is like way over there and I can't get out of bed. I can see the cup. It's right there. I'm really thirsty. You know what she's going to do? She's going to hit that call light. And you're going to walk in. How can I help you? Oh, I need that cup right over there. I just can't reach it. Okay. Wash my hands. Give her the cup. Wash my hands again. Leave the room. Go take care of patient number 2 that I'm still trying to work on. And now that she's had a drink, after 10 minutes, she's going to be like, I got to pee. I can't go to the bathroom by myself. I got to pee. I'm going to hold it. I don't want to irritate that CNA. I'm going to hold it. I can't hold it. I got to go. So she's going to hit the call light. Now, you've been trying to give patient 2 a partial bed bath and you've been interrupted 3 times. You're probably going to get a little irritated at her. And I'm going to tell you, it's not her fault. It's yours. Because if you had slowed down during your closing and you had asked, is there anything else I can get for you? And meant it. We could take care of the blanket and the water. Would you like to go to the bathroom before I leave? We can take care of all of that. She'll stay off that call light. Give me at least a half hour to do what I need to do. Does that make sense? This is why you need to ask and you need to mean it. Is there anything else I can do while I'm here? If you do that, your call light use will go down dramatically because your patients will feel cared about as well as cared for. And that's a big reason they're on the call lights. Good? Does that make sense? So your closing is, thank you very much, Miss Jones. Is there anything else I can do for you while I'm here? Are you comfortable? Would you like a magazine before I go? No, you're good? Bed's in the low position. Environment's clean. Open the curtain. Here's your call light. Everything good? Okay, I'm going to go wash my hands. Chart if necessary, and then wash my hands again. My skill is done. Good? Make sense? Okay. And again, I've got a video for that. So here are your closing. Clean and safe, comfort. Patient needs to be covered at the end of the skill. That's part of comfort. Open the curtain, give them the call light, clean your hands, chart, and then clean your hands at the end of the skill. And I've got a activity in the online program for you if you want to use that. So let's talk about hand washing because we learned that we have to wash our hands during the opening and we have to wash our hands during the closing. So now we have to learn how to wash our hands. I know we're going all the way back to kindergarten for this one. So page 44 has the steps involved in hand washing. Remember, it's part of the opening and the closing. You've got the actual checklist from the state exam and our cliff notes here. And hand washing is going to be graded at the beginning and the end of your first skill. Nobody's going to tell you to go wash your hands. You have to know when you're supposed to wash your hands, which is why the opening and closing is important. I got step-by-step instructions on page 45 for you. But let's talk about warm, dark, moist. Pathogens need a very specific environment in order to thrive. Pathogens usually thrive in warm, dark, moist environments. Bathrooms are usually 2 or 3 degrees warmer than other environments because we don't like to be chilled when we get out of the shower. Bathrooms are usually dark. Mom trained you, turn the light off when you leave the bathroom. And moisture is present in bathrooms with toilets and sinks and showers and such. So bathrooms are the ideal breeding environment for pathogens. Ideal. That means that every bathroom you go into, there's pathogens there. What we don't want to do is spread them around. So our steps here are going to be very important. Very important. So the steps involved, what I'm going to show you is going to translate into the actual checklist. So every part of that checklist is going to be checked off. When we're washing our hands, there's a couple areas that we tend to miss. This area here, we tend to forget about when we're washing our hands. The bottom of your hand by your pinky. So they're going to be watching for that. We tend to get our thumbs pretty well. We also tend to get the fingers themselves and the palm good, but not the back of the hand. We also don't get in between the fingers very well. So when you're seeing this skill demonstrated, pay attention to all the areas I actually scrub. Okay. Faucet handles are dirty. They're the dirtiest thing in the bathroom. You cannot touch them once your hands are clean. You can to turn the faucet on because your dirty hands can touch a dirty faucet, but not once they're clean. We're going to wet our hands before we apply soap. We need the soap to distribute. If you just put soap on a dry hand, it's not going to distribute. It'll clump. We need the hands wet first. That's an actual testing checkpoint. You're also graded on bubbles. I am not kidding. I'm not kidding. You are graded on bubbles. If you don't work up a lather during the test, you will fail hand washing. Bubbles count. So if you start rubbing your hands together and you're not getting a lot of bubbles, get more soap. Start again. Okay, bubbles count. Once you apply soap, you need to rub your hands together for at least 20 seconds. And you want to use the clock to time yourself, not singing the clock. But it has to be at least 20 seconds. More is fine, less is not. If you only rub for 19 seconds, you will fail hand washing. You want to keep your hands lower than your elbows and over the sink so that everything runs into the sink. You're going to circle your wrists. You'll scrub the backs of your hands and in between your fingers, the palms of your hands and in between the fingers, your thumb and the webbing, and the bottom of your hand by your pinky. And remember that we have areas that are frequently missed that they're watching for. Remember that it has to last at least 20 seconds using a clock. Don't sing. How many guys were taught to sing? ABCs, Twinkle, Twinkle, right? What do you think happens to your singing speed when you're nervous?
It gets faster.
That's right. So it's no longer an accurate gauge of time. And for the test, you're going to be nervous. Don't sing. Use the clock. When you go to test, there's 2 evaluators in Florida. One of the evaluators is standing by the sink watching what you do. The other evaluator has a pen and paper. And when you wet your hands and you get some soap and bring your hands together, they look at that clock to see where the second hand is. It's on the 7. They actually write that down. When you rub and then you move to your nails, when you move to your nails, they look at that clock and they write down 10. That's only 15 seconds. So what do you? Yeah, what do you think is going to happen to your score if you only rub for 15 seconds? Yeah, you're going to fail. Good. Makes sense. Do you guys understand how they're timing that?
Especially on cross-examination.
Yep. Use the clock. They're using the clock. Use the clock. All right. Once you've rubbed for at least 20 seconds, then you're going to move on to your nails. You'll take your thumb, go down to each one of your nails to get your cuticles, rub your nails on the palm of your hand to get underneath. And then we're ready to rinse. When you rinse, don't touch the sink or the faucet. Keep your hands lower than your elbows and inside the sink. Once you've rinsed completely, we're going to dry. Leave the water running. Dry your hands. Throw those paper towels away and get some clean, dry ones to turn the faucet off. Don't use wet paper towels. Wet paper towels rip. Remember, the faucet is dirty. If you rip the paper towels when you're turning the faucet off, you'll recontaminate your hands and won't even realize it. You're going to take that over to the patient, and that can have a detrimental effect. Good? Remember, all of these steps count. So let me show you the video for this one. Normally, I do this one live, but my camera doesn't look like it's kind of fritzing out on me there. Yeah, I'll show you the video. Video has good close-ups. Okay.
When you approach the sink, you can touch the faucet with your unclean hands because the faucet is considered the dirtiest object in the bathroom. Adjust the water temperature for comfort and wet your hands. Apply soap and rub all surfaces of your hands vigorously, focusing on the front and back of your hands and in between all fingers. Circle the top of your wrists as well. Friction is the key to removing all pathogens from the surface of your skin. Friction should be applied for at least 20 seconds to be effective. After washing with friction, the nails must be cleaned. Run one thumb down the length of each nail, starting at the cuticle and moving toward the end of the nail. Repeat with all fingers of both hands. Then clean under your nails by scrubbing the underside of your nails along your palm to remove debris. Carefully rinse your hands under the stream of water with your fingertips pointing downwards, taking care not to touch the inside of the sink or the faucet. Tap your fingers together to ensure that all water droplets remain in the sink. Take paper towels from the paper towel dispenser and dry all surfaces of your hands, the front, back, between your fingers, and your wrists, taking care not to allow the paper towels to touch the unwashed areas of your lower arms. Throw these paper towels directly into the trash bin. Finally, take a clean, dry paper towel to turn the faucet off, because wet paper towels may rip and recontaminate your hands.
Okay. Any questions on that? On hand washing? Okay. So let's see if we can put all of these steps in order. So if you go to the online program, the online course, I actually have the care plan. You can click the button and see the care plan for every skill that we have. And you can click the button and see the testing checklist as well. So all of that is embedded in the program along with the video that you just watched. And let's see if we can put these in order. So if you look at those 8 steps, what is our first action here? Turn the water on. Okay. What do we want to do next?
Wipe your hands.
Wet your hands.
Oh, no, wet your hands.
Wet your hands. Everybody agree?
Yes.
Okay. Now what do we want to do?
Apply soap.
Also,
Apply soap. Okay. Now what?
lather all surfaces.
Lather all surfaces.
The clock.
The clock. Okay. All right. Now what?
Rinse all surfaces.
Rinse. Okay.
Dry hand with thermal.
Okay. Dry hands and then turn the faucet off, right? Let's see if we got it right. We did. Gold star. Good job.
You're supposed to use a paper towel, right, to turn the faucet
To
off?
turn the faucet off, right? A clean, dry paper towel.
That's what I thought.
Clean, dry paper towel. Okay. And remember, don't sing for the test. All right. So page 28 is going to talk to you about indirect care. I've got 10 minutes left. And we're going to go over this very briefly. But indirect care is how you treat the patient when you're doing these skills. So the best way to describe this, guys, is to treat the patient the way you would want to be treated. So if you and the patient were changing places and they were doing skills on you, how would you want to be treated? So we want to make sure that we're making eye contact, that we're slowing down, that we're communicating in a way that they can understand. And sometimes that means slowing your speech down a little bit. You want to make sure that they're comfortable, that they know what you're doing. You know, basically, how would you want to be treated? But indirect care is actually going to be woven into the skills steps that we're going to be performing. So you're going to hear a lot more about indirect care as we go because it makes up some of our skills steps. But the biggest thing to remember are that these are the things that we want to pay attention to. Eye contact. Remember, half of our job is observation and reporting. If we're not making eye contact, we're not making observations. It's that important. Tone of voice is going to matter. Rate of speech, how quickly you're speaking. Remember, they're preoccupied. Facial expression. Do I look bored, impatient, frustrated? Pay attention to your facial expression when you're working with patients. Your body language is going to matter. When you're speaking with patients, you should be facing them, not like this. This tells this patient that he doesn't matter to me. He's not my focus. This tells my patient I'm standing up. I have good body posture. I'm open. I have eye contact. This tells my patient that he is a priority. Good? Makes sense? Providing explanations and your overall attitude. This is what is going to impact indirect care. So, to review your homework tonight, you are going to read chapter 1 in the yellow book. You are going to do the test on page 181 in the white book and grade it using page 201. When you come back to class on Wednesday, I'm going to get your grades and we'll go over any questions that you have. You're going to get the invitation for the course. You want to accept the invitation and create your account. That way you can do those lessons in there. You will have access to the online program for 1 year from the time that you accept the invitation. So don't worry about accepting it now and running out of time. You got plenty of time. Okay. Remember, don't write in the book. Okay. So you have a review sheet for today. You're going to get a review sheet for every single class that we have. And these review sheets are if you keep up with them, they're a great way to review for the state exam. Okay, so you're going to get 8 of them. They're double-sided, so you've got some questions on the front. And here, remember that we learned skill rules, the opening and the closing. This is going to help you identify whether you got all of those steps. Okay, so it creates a really good review sheet for you. It also has our scope of practice on there. So I'm going to hand this out to you. The answers are on the bottom, so upside down, so you can double check your answers if you want. And like I said, you'll get one of these for every single class. For those of you online that are watching, if you go to our course, courses.foryourcna.com, Caitlin, if you can put that up for me, courses.foryourcna.com. Under each class video, you'll see a link for the review sheets. I've actually uploaded these in our online course for you. So if you guys aren't able to come to class, you can still get these review sheets. You can download them yourself and print them out yourself at home as well. Okay? If you can pass those out for me. All right, does anybody have any questions for me on what we've gone over in class today? Did I go too fast for anyone? Did I go too slow for anyone? Everybody good?
Yes.
All right. You will need your blood pressure cuffs and stethoscopes in class on next Monday. Yes, next Monday. You will need your blood pressure cuffs and stethoscopes in class on Monday. So you don't need to bring them to class with you. You don't need to bring your yellow book back and forth to class. Take your yellow book home and leave it there. It's just for homework reading. But your white book you do need in class each class period because that's what we're going to focus on as we go through. So Christine asked, how many skills do we need to do for testing? You'll want to, if you're testing with Prometric, you're going to be tested on 3 skills, 1 ADL skill, 1 mobility skill, and 1 documentation skill. Our book, this book has all of the testing care plans in it. All right. Any final questions for me? Please remember, don't go anywhere yet. Please remember that I only open the door about 10 or 15 minutes before class. So if you're super early, go get a cup of coffee. On your book, the yellow book, there is a number. It's Y something. When I call your name, if you can tell me what your book number is. That's how I keep track of who has what book. Victoria.
Y12.
Janelle. Elizabeth.
Y11.
Zachary.
Y1.
Kiera.
Y13.
Neftali.
Y12.
Isabel.
Y10.
Andrea.
14.
14. Cassidy.
7.
Giselle.
2.
Lacey.
8.
Queenie.
9.
Thank you. All right. That way I know who has what book. All right. Have a fantastic day. I will see you guys on Wednesday at 9. If anybody has any questions,